Okay, thank you. Welcome to the Thursday, March 18th, 2021 Oregon Liquor Control Commission. We'll start by taking the roll, please, Laura.
Commissioner Curran,
Here.
Commissioner Floyd,
Here.
Commissioner Harper,
Here.
Commissioner Miletus,
Here.
Commissioner Pasek,
Here.
Commissioner Raval,
Here.
Chair Rosenbaum.
Here. We're particularly interested in the discussion about COVID controls and mask requirements. It's a matter of utmost concern to all the commissioners. I can say that without hesitation. And I'm very pleased to have Dr. Dean Seidlinger here from the Health Authority. Dr. Seidlinger, the floor is yours. We're all ears and we're anxious to hear what you have to say.
Thank you. Good morning, Chair. Good morning, Commissioners. Thank you for having me. I've put together a few slides that'll help keep me on track, give you a little update of where we are right now with COVID-19, what some of our projections show, and what some of the recent changes have been, and how we think about bars and restaurants in our guidance and transmission and where that direction may go. So next slide, please. This is what we call our epidemiology Epi Curve, or epidemiology curve. It's posted on our website. This has individuals who become sick with COVID plotted by the day they got sick. Those plotted in orange were not hospitalized, in blue have been hospitalized, and in gray, kind of unknown hospital status. You can see what we thought was a kind of blip in cases, or a surge in cases in March, is dwarfed by what happened in the winter. We saw a fairly low level of cases once our Stay Home Save Lives order was in place, and then an increase in cases over the summer after more business sectors opened up and people were moving around more. Those came down as we went into the fall, and then we saw a large surge in cases beginning in November, December. This is when the county risk level metrics were put in place, set over 4 risk levels based on transmission in counties to try and allow more activities as cases went down, and to give some predictability by pulling data each week and publishing that. We were able to make it through Thanksgiving and the end of the year holidays relatively much better than other states. While we did see this large surge in cases, it did not go as high as other states and came down rather precipitously following the holidays. Those cases have now leveled off, and you'll see in some future slides it started to increase a little bit. So next slide. When we look at our hospitalizations, we know that most people who get COVID, they either don't have symptoms or have mild symptoms and recover. There's a subset of people who seem to have long-term symptoms, and that is a hot topic of research and study to find out what is going on with them and what can be done to relieve their symptoms. But there is a small subset of folks who are hospitalized. This dark blue line with the biggest peak is the number of Oregonians in a hospital on any given day. The middle line is the number of individuals in an intensive care unit bed, and that bottom lighter blue line is the folks who are on a ventilator for COVID. As you can see, we saw a rather steep increase with our winter surge. We plateaued a little bit and then came down. That decrease started before vaccinations really kicked in, and I think is a testament to some of the measures that were in place, particularly around skilled nursing facilities where some of our most vulnerable populations live, and we've seen about half of our deaths come from changes in treatment, and then vaccine really did help, I think, to get this rate coming down. With seniors and other adults with chronic conditions who live in congregate care facilities being amongst the first vaccinated starting in December, that is having an impact on these hospitalizations. So this is all great. We're nowhere near where we were in November, where we were worried about people being able to access an intensive care unit bed if they needed it, whether that was for COVID following a heart attack or after a motor vehicle crash. So we're in a much better place now. Next slide, please. When we look at trends week over week, we can see that we look at our weeks beginning on Sunday, ending on Saturday, that for the period ending this past Saturday, these numbers change a little bit day to day as we get more information on cases. We had just under 2,400 cases. That was up from the week prior when we had 1,700 cases. And that had been a precipitous decline from the 2,800 before that. If we look more historically, we had seen a rather steep decline and then a gradual slowing of that decline. So now we kind of appear to be at a place where we're leveling off and potentially coming up a little bit. The reason we this is real, and the reason we worry this may be a trend is we know that we are about 5 weeks out from many counties opening up to more activities, so a chance for people to get out and interact with friends, families, and loved ones, more sectors available to them. We also know that we have some variants of concern, meaning mutations of the virus that are more easily transmissible that are showing up in Oregon, not quite to the percentage that are showing up in other states, but that will also raise our cases. At the same time, we have a powerful new tool in 3 vaccines that are very safe and very effective against this disease. So kind of how that kind of works out into the future is, is hard to predict. I'll show you some of our trends and what some of our partners are saying, but we do anticipate some continued increase in cases, but hopefully not too high, and that we will get that under control with vaccination. Next slide. This slide also shows our cases that we report each day, so on the date that they're reported, so it's a little more kind of current information. It does tend to adjust as cases come in, but the yellow is the actual number of cases we are reported to us each day, and then that kind of light blue line we average over 7 days. So this kind of illustrates what I've been telling you. We had seen this kind of week over week decline in cases. We flattened out a little bit at the beginning of February and then declined a little more, but now we appear to be on this slow increase, and looks like it may be flattening out these last few days, but that slow increase is what worries us. Next slide, please. With that in mind, we see a significant change in this county risk level map. This map is based on the number of cases in the county. So for our largest counties, we look at the cases per population, as well as the percent of positive tests in that county. For our medium-sized counties, we look at the number of cases in the county, as well as the percent positivity. And for our smallest counties, we look at just the number of cases in the county over the previous 2 weeks. The reason we use a number of cases in the smaller and medium-sized counties is it allows for more disease in those counties, knowing that there's less density, people are more spread out, and so the transmission patterns are different in those counties. 2 months ago, when we looked at this map, it was primarily red, with counties showing high levels of spread of disease, with much less counties to the left. Over the last 2 months, this has really changed. And I think, while we've seen decreases in cases across the country, our decreases in cases happen sooner and probably more dramatically after the holidays in many of our states. And I think it's this risk level framework that does that. So we've seen most of our counties now have moved into the lower or moderate risk, the green and yellow, which means there are more businesses allowed to operate and more activities that are allowed to occur inside. We have 2 counties still that remain in extreme risk, though they are showing some slight decreases and improvement in their numbers over the past couple of weeks. So next slide. So with that data as a background, let me show you what our latest modeling shows. And while we don't predict the future, we use this for planning purposes. So next slide. This graph shows a map of what we call the R number, or the effective reproductive number. That dotted yellow line that's horizontal is at 1. And that indicates that for every person who's infected, they infect one other person. So we're in this kind of, as someone said earlier in the call, Groundhog Day, where it's the same thing over and over again. We want that number to be below 1, meaning that the disease is slowly decreasing, or quickly decreasing if we can get that very much below 1. That number has been below 1 in Oregon throughout much of January and February. These modifications, these hills and valleys are there because we pump a lot of information into this model, so it tends to show more variation day to day than some of the national models. But this is good news, that for each person that's infected, they infect less than one other person, so we see a slowing of the spread of disease. Based on this data, next slide, we do some short-term projections with our model that look about 4 weeks out into the future. So this model is from last week. We look out about until the end of March. That green line there that continues down shows the rate of cases in Oregon. It is moving the cases over the next month towards the lowest risk level across the state for a state average, and that's good news. But what we know and what we've seen from the data since this report was shown is that we have more variants of concern that transmit more easily and more opportunities for people to get together. So we do expect some increase in transmission. That red line represents about a 30%, 25% actually increase in transmission, and puts our cases essentially flat through the end of March. Some of our partners do longer term projections, for example, at OHSU and IHME, which is a modeling group out of Washington. They project that with rising numbers of variants and vaccines not quite catching up and being able to prevent that spread, that cases in Oregon, as well as the rest of the United States, will increase through April, likely peaking in March. The OHSU model and the IHME model tend to be fairly pessimistic. So while we do anticipate those cases increasing, we don't know if they'll go as high as they're predicting, with OHSU predicting a peak almost as high as our winter peak. But we do know that we can't take our eyes off the ball. We need to continue the current measures we have in place to control the virus while we get more vaccines into arms to offer protection. A little word on the variants in the vaccine. You've seen different kind of effectiveness numbers for the vaccine, but we can't compare them, one to the other. The studies were done at different times and with different levels of variance in the community. But we know about all of these vaccines during clinical trials is they prevented 100% of serious infection, meaning people hospitalized and death during those studies, even with variants of concern. For example, the one from South Africa and Brazil, and the B117 from the UK. They do offer a level of protection and tend to prevent those most serious diseases, even if they aren't quite as effective at preventing all cases. But even saying that, all three of the vaccines are very effective at preventing disease, with up to 95% protection from the first two. And depending on how you use the data, it's 80 to 85% effective from the Johnson & Johnson vaccine. So those are all great news and nothing I would have predicted a year ago when they said they were just beginning to work on a vaccine. So next slide. With that being said, I'll show you a little bit about vaccinations and how we're doing as a state. Next slide. This shows a dramatic increase in vaccinations day to day, week over week, since vaccines first became available here in December. The bottom product is our Pfizer-BioNTech product. The lighter blue is Moderna, and those little blue tips to the right are Johnson & Johnson. The first two vaccines require 2 doses. The Johnson & Johnson vaccine requires a dose. Earlier this week, about 1 in 5 Oregonians had received at least 1 dose of vaccine, and about 1 in 4 Oregonians over the age of 18 had received the vaccine. So we are getting vaccines into arms, and those are increasing day to day. Next slide. When we look at vaccines delivered by age group, it should be no surprise that those oldest Oregonians have received the most vaccine, as they were prioritized in the congregate living and skilled nursing facility allocations initially. And then after those facilities and healthcare workers and educators were vaccinated, seniors living independently were authorized for vaccine. About 2/3 of those over 80 have received the vaccine, with lower numbers as you move down through the senior population, and significantly lower numbers in our 20-year-olds, 30-year-olds, and 40-year-olds, many of whom were vaccinated because of their place in the workforce, healthcare, long-term care facilities, or in education. We have a phased approach that was going to bring us into the summer to bring on the additional folks who become eligible for vaccine. That schedule will be accelerated to meet the federal mandate that all individuals will be eligible for a vaccine by May 1st. And that includes individuals who would work in bars and other restaurants and establishments that serve alcohol, so that they can have a level of protection against this virus. As you'll see from my next slide, we do see concern about spread of COVID-19 in these types of establishments. Next slide. So let me talk a little bit about how we think about transmission, and we want to line up different tools to try and prevent transmission in different settings. Next slide. What we know about COVID-19 is it's spread likely primarily through aerosols. So kind of larger particles that typically travel a short distance. We often think of 6 feet. That's not a magic number, but these are particles that people emit when they cough or sneeze or talk. They can also be transmitted via smaller particles that suspend in the air a little longer, what we call aerosolized transmission, and they can travel longer. We've learned more about this aerosol transmission in COVID and know that it does account for transmission of this disease. The other place we worry about transmission is that when those aerosols or droplets land on a surface, that if you touch that surface and then touch your mucous membrane, so your nose, your mouth, your eyes, you can become infected as well. That doesn't seem to be a driving force for transmission. It's primarily these droplets and aerosolized transmission. So how do we reduce that risk of transmission? How do we protect ourselves, and how do we set guidance that helps guide how people are protected when they move about in Oregon? We know that being outdoors is lower risk than being indoors. The virus dissipates into the air. There's some impact from UV light as well that can help. So outdoors with good, a good breeze blowing in the open space is definitely the safest place rather than indoors. As we move indoors, we know that increasing the ventilation is better than poor ventilation. That can be done through air exchanges with an HVAC system or opening a window and fans and use of filters to filter the air. We know that being farther apart from people is better than being close to people. That accounts primarily through that droplet transmission that doesn't travel very far. We know that less time together, less exposure is better than more time together. We use a definition of someone who we consider to be exposed of within 6 feet for 15 minutes or more during the course of a day. Again, 15 minutes isn't magical, 6 feet isn't magical, but we use those cutoffs to kind of indicate where more contact has occurred and we are more worried about transmission. We know that if we stay home and have contact only with our household members, that we're much less likely to transmit than we have contact with individuals from outside the home. That's a spectrum. So someone who's a hermit who has no contact with anyone, to someone who has contact with a few people, to someone who has contact with hundreds of people, your risk level for transmitting to others, if you are sick and have the virus, and you can be sick and not know it because we see transmission before people develop symptoms and people without symptoms, to your risk of getting the vaccine from someone around you who may not be showing symptoms. We know that the use of masks by all of the individuals in a space is better than no use of masks. The primary purpose of a mask is to protect those around you. So that mask acts as what we call source control. So if you are sick, and particularly if you're sick and don't know it and are out at the grocery store, in a restaurant, at work, you could transmit the virus. So what wearing that mask does, and that's at least either a medical grade, like a surgical mask, or a mask with 2 or more layers of tightly woven material, and we have this on our website, that fits above the nose, below the cheek, below the chin, and snug across the cheeks, can prevent, does a very good job at preventing you from making those around you sick. That same mask does offer a level of protection to yourself as you breathe in, if there's COVID-19 in the air, but it really serves more as source control for someone who may be sick. And lastly, we know that being vaccinated is better than not being vaccinated. So we take these things into account as we set up guidelines for different sectors. And so you'll see that typically in the same sector that can operate indoors or outdoors, we will allow more people to come together in an outdoor setting than we will in an indoor setting. We know that we have universal mask requirements for when you leave the home and you're going to encounter someone else, whether that's indoors or even outdoors, though the risk of transmission is lower in those outdoor settings. We know that certain settings can, we lose some of those tools. So we want to line up each of these tools like slices of Swiss cheese. And the more slices we have together, the less likely that those holes line up and that COVID could come through. So we know that in certain settings, like in a gym or fitness facility, we lose one of those tools. Our masks are not as effective in that setting because they get damp, and so they can allow more of the virus to come through them. We also know that the reason people go to the gym is they want to work out and get their heart rate up. That gets their respiratory rate up. And as people breathe heavier, they can spread the virus further if they're sick. So we lose a couple of those tools. When we talk about bars and restaurants, we also lose a couple of those tools. For us to eat or drink, we need to remove our mask, and so that removes that tool. We go to a bar or restaurant typically to meet up with folks that we don't live with, that are outside of our household, and we sit closer than 6 feet together at that table. So that loses that tool. If we move that contact from outside to inside, we lose some of that fresh air and the ability for the virus to dissipate. So that's how we look at guidance. So next slide. This is the guidance chart that you're probably all familiar with, and it just is posted on the OHA website. And this, I just cut it off at the eating or drinking establishment. The reason we have more strict kind of rules and lower capacity limits in bars and restaurants is, as I said in that previous slide, we lose some of those tools. But we set it up so that as disease rates go down in the community, more people are allowed to get together indoors and outdoors because the risk goes down a little bit as there's less COVID in the community. But when there's a larger amount of COVID in the community, for those counties in extreme risk or high risk, the risk of spread in these settings tends to go higher. And that's why the restrictions look a little different in eating and drinking establishments. You'll see we have more restrictive guidance in fitness facilities, and then on down the line in our risk level guidance. So next slide, I think that's all I have, and I wanted to leave a time to answer your questions and have a discussion.
Thank you so much, Doctor. That was very informative. I appreciate it very much. I'm going to open it up now to the commissioners. Would you please ask the doctor any questions that you have, if any?
Chair,
Commissioner?
Commissioner Floyd here. Good morning. Thank you, Dr. Seidlinger, for your presentation. That was very insightful. Really appreciate you coming and speaking with us this morning. You know, I'm sure you're very aware our bar and restaurant licensees have been absolutely devastated from this past year. They've been through several shutdowns and are still going through, you know, extra layers of restrictions specifically imposed on the hospitality industry that other businesses in the retail sector don't have. The OLCC, in my opinion, has done a remarkable job to try and help the industry expand those margins wherever they can. And so my question for you is there any fact-based data out there that you can share with us that suggests COVID transmission comes from bars and restaurants, Dr. Seidlinger?
Yeah, so I think we use a variety of different research and data in assessing these guidance. So one, just from the kind of how the disease is spread, I laid out some of those, the fact that we don't use our masks and we could see more spread. What we've seen most recently, a study came out that looked at county by county level data over most of 2020 and looked at associations of cases and deaths from COVID with several things, and two things came out significantly associated with the spread of COVID. When counties had a mask mandate in place, COVID cases went down significantly, starting at 20 days after the mandate, and they studied it out for 100 days, with deaths also declining in a similar piece. On the flip side of that, counties, most states, 49, I believe, had some restrictions on indoor dining for a time. And as those indoor dining restrictions were lifted and people were allowed to eat and drink inside, there was also a significant association with cases, but cases went up. starting at 41 days after restarting indoor dining, and the study period ended at 100 with a subsequent increase in deaths. So that's one study that just came out in the last week that really had a significant amount of data over time across the country. What we've seen also is associations as we reopened with movement. As we probably all know, the technology companies are very good at tracking us through our phones, and that kind of anonymized data and looking at movement as communities opened up showed a significant association with people who went into bars, restaurants, and taverns, as they call them, or bars, restaurants, and cafes compared to other sectors, and that was one of the highest association pieces. We also, there was a case control study that was done that essentially looked at people with COVID, people without COVID, and compared activities they did, and found a significant association with people. The two things that were most likely to have you test positive for COVID were either you had a close contact with someone who is known to have COVID, or you visited a bar or restaurant in the previous 2 weeks. So those are some of the kind of macro level. There's another one that looked at credit card spending after reopening and found associations. Then we also see outbreaks in bars and restaurants. One of the most, the earliest one was a restaurant in China that really could demonstrate the airflow and where people sat, and showed spread as people sat in that bar and restaurant without their masks on, and showed the index case and then the folks in the airflow of where people got sick. We do have several kind of outbreaks of COVID in bars and restaurants in Oregon. Not as many because, as you stated, there's been some significant restrictions on indoor activities in these settings. Most of those outbreaks have involved transmission from staff to staff who spend more time together than from the customer to staff, but we have seen some transmission amongst customers and in these settings in Oregon. And there have been many case reports that have shown explicit spread in these settings in other states. So that's some of the evidence we have. I can send a little summary of how we pulled together some of those reports just so you guys can look at that.
That would be helpful. Thank you. I'm sorry, Commissioner, please go ahead.
No, that would be great, Dr. Seidlinger. If we could have that, that'd be very helpful. As you know, we're speaking with licensees every single day, many of us commissioners, and so that would be helpful to have that information in hand. The biggest looming question, and I don't know if, as you said, you can't predict the future, but, that we have from our licensees, do you foresee any further shutdowns to the industry?
Let me say that from the data we have and the projections we have, things look like that overall we'll see an improvement through the spring and the summer. I think we are going to see an increase in cases, likely not followed by that same increase in severe cases or hospitalizations because of the impact of vaccines. The question is, how much is that peak blunted by increasing vaccines in Oregon and other states as variants spread? And I think that's the part that's hardest to predict. We are in constant communication with the governor's office and several folks on the phone here about how does our approach to curbing this virus look as vaccination rates go up, as people have more opportunities to move outside as the weather gets better and cases go down. So I would anticipate, likely similar to the announcement that came out yesterday, to allow higher capacity of folks in outdoor entertainment and fitness facilities because there's a lower risk of spread. The other guidance will change that way as cases have come down, and likely we'll have an approach that would allow more folks, particularly in outdoor settings in bars and restaurants, and then even a higher capacity indoors, knowing that that is a higher risk of spread because we have to remove our mask and we sit closer together. I'm hoping that that also coincides with the opportunity for staff in these settings to have been vaccinated, because unlike us as patrons of bars and restaurants who choose to go and may only spend an hour or an hour and a half there, these staff spend a significant portion of their day there. And so being able to have that protection, which will come into play as we move into May and everyone becomes eligible. So I think those things together would point to us seeing some opportunities for increased patronage in these settings, and hopefully some ability to get back some of that business because bars, restaurants, hospitality, but many other businesses, the impact of COVID and our restrictions have been devastating, and we need to kind of get those back. And I do anticipate improvements there as we move into spring and summer, and hopefully those will continue through the fall, but that really, my crystal ball gets a lot more hazy when we get that far out.
That's great. That's great. So lastly, it looks like, as you've stated it, with most everyone, hopefully by May, we should, for all adults who want one, can get one, should be able to be vaccinated, correct? When this time comes, will we then see the occupancy restrictions to our licensees? That's the 25%, 50%. Will we see those restrictions be lifted, or how do you foresee these restrictions being relieved as more and more people get vaccinated, or as it's open, there is enough vaccinations for everyone come May?
Right. So I think the way I look at vaccines is, vaccines are protective, which is great, but probably not tying recommendations to specific vaccination rates, but knowing it's those vaccine rates that are helping us get cases down and hospitalizations down. And I think, after we get through this potential surge from variants, we should have enough people vaccinated that we'll really see those cases, unless things change, coming down through the rest of spring and into summer. And I think that's going to drive decision-making and recommendations to the governor's office and guidance that comes out about restrictions. I do think that at least for the short term, as we're getting more people vaccinated and through the summer and into fall, likely, we'll have some guidance in place beyond vaccine that will help us control the spread of the disease. So wearing a mask, particularly in indoor public places, probably is not going away for a while, even as more people are vaccinated. Because while even those first two vaccines are incredibly effective, 95% effective at preventing all disease, that still means about 5 in 100 or 1 in 20 people who are vaccinated may still be able to get disease and spread it. So where we can use a mask indoors to help prevent the spread of disease, I think that will continue. And then likely, we will encourage more activities outside, which I know can provide some relief for your licensees, but not complete relief, but that's a safer place. And many municipalities have worked with your licensees to kind of promote those outdoor spaces. And then we will see some increased occupancy limits likely in indoor activities. They may be a little more restrictive, I think, in bars and restaurants, again, because people have to remove their masks when they eat or drink. But I do anticipate that you would see increasing occupancy limits as we move spring into summer for your licensees.
Great. Chair Rosenbaum, many of our licensees and the 70,000, more than 70,000 Oregonians that they employ, they just, they feel lost, right? And they feel that they've gotten a little bit of a raw end of the stick, or the brunt end of it anyway. And they just want to know how they can successfully and safely, operative word, plan for the future, with everything being so uncertain. So again, Dr. Seidlinger, thank you so much for coming and speaking with us today. I really appreciate it.
Thank you.
Commissioners, the floor is open.
Hello, Chair.
Commissioner Curran?
Good morning, Dr. Seidlinger. I appreciate you coming on and providing us with this information. It's great to have somebody here to share that information with us. One of the questions I have for you is, can you tell us where my understanding from what I've heard from the governor has been that the majority of the spread has been, if we listed them in order, would be that the top super spread areas would not be bars and restaurants. My understanding is that workplaces, we've heard of a lot of workplace outbreaks, large family home gatherings, Super Bowl parties, New Year parties, Thanksgiving holidays, prison outbreaks. Those types of things have been the largest factors or the largest reasons for the spread. Can you confirm any of that?
Yeah, so I think, our largest outbreaks have definitely been in Department of Corrections facilities. We've seen spread in healthcare facilities as well, in cases associated there, and many other sectors. You're right that bars and restaurants aren't near the top of the list, and I think that's because we have some strong kind of health and safety guidance in place. And I've really limited the indoor activities in those places because we know several of those tools aren't available to us. So that, I think, has limited spread because, they've not been operating in a normal fashion for a year now, and so has limited that spread. Places like Department of Corrections, by many of our food processing facilities where we've seen large outbreaks with our migrant and seasonal farm workers and others, can't stop working. And so those activities have continued, and we have seen larger spread as large numbers of people come into contact indoors, or even in the case of migrant and seasonal farm workers, outdoors or in housing. So I think, we, like many other states, have seen less of an impact from bars and restaurants, I think because of the approach with the safety guidance and unfortunately the restrictions that have had, I think, tremendous negative economic impacts on businesses, but have limited that spread in places where we know many of those tools of keeping people 6 feet apart and wearing masks and airflow don't always come into play for us because we lose the ability to use those tools.
So I hear you say, and to us today, and I think that a lot of this is common sense, that we have gained a lot of information, staying 6 feet apart, wearing masks. We've all been doing our part and doing all of this. I think that we've been doing that, but and we can quantify. If I look at the CDC website, for example, it doesn't say that we need to close down restaurants. What it does say is it makes recommendations about what's more risky. Outdoor dining is less risky. This is more risky. But is there a way to quantify that? It's one thing to say it's more risky. It's another for us to, especially at the policy level where we should be doing a risk assessment. Can you quantify that risk for us?
Again, the two things that were associated significantly with increasing cases and driving cases were mandated masks were significantly associated with reducing cases 20 days after that goes into impact. And reopening of indoor dining shows a significant association with increasing cases starting at 41 days and a subsequent increase in deaths after that. And so, you can read the statistics in the link to that report when I send it out to you. But that really gives us a broad level of data, county by county, over the association with restarting indoor dining and increasing cases that's not seen with the restarting of other sectors.
So the answer is, I didn't hear a quantification such as we will see 2% more community spread. I want to know, and I would like for there to be some more quantification, because the problem that we're having, like I said, this is a risk assessment. We are telling people it's more risky, but if I go into a restaurant and I see that people are, I think Commissioner Floyd's point is that we may be able to do this more safely. If everybody is wearing masks, if the staff is wearing masks, if we are opening doors, we're sanitizing everything in between, and we're really putting in policies that will reduce the spread and reduce the risk in indoor dining. Why isn't that enough? And that's the main question I have is, if there's no quantification for you to be able, I understand that you're saying if wearing masks, everything goes down, and those studies, absolutely, we understand that, but we're looking for more of a quantification of, if we open restaurants all to 50% and we let them stay at 50% and operate at 50% with the guidelines of everybody wears masks, we limit table sizes, we do what we can to implement everything that you put on slide 15, which was stay apart, wear masks, sanitize. If we do all of that, can't we safely open this industry more than what it is?
Again, but some of those tools we can't use in the setting of a bar or restaurant. Someone who comes in to eat or drink has to remove their mask while they're eating or drinking. If we're allowing people from different households to come together and sit at a table less than 6 feet apart, we're not doing the physical distancing we need to do. So some of those tools kind of we lose. And then, for the quantification, I will say that the association with opening indoor dining, that we see an increase in deaths 41 days after opening indoor dining by 1.1%. It goes up to 2.2% 61 days after, and a 3% increase in deaths 81 days after reopening indoor dining. So that's some of the quantification that I can give you in the reports that we'll send out afterwards.
And is that data correlated directly to the opening of businesses, or is that also correlated to the opening of, usually when bars and restaurants are opening in these situations, we're also seeing larger gatherings with families. So can you show a direct correlation?
This is an association between states looking at county level data on when they allowed on-premise restaurant dining and changes and increases in COVID cases and deaths following that.
Did it also consider, though, what other things were allowed at the same time that bars and restaurants were opened?
Again, the only significant correlations they saw were with the restarting of on-premise dining and with instituting mask mandates. Other sectors were not associated with the same increase in cases or decrease in cases as mask use goes and deaths.
Thank you. So, and then going back to your slide, in October and November and December, when we started to see that dramatic increase, and it continued for several weeks. For most of that period, bars and restaurants were closed, but the spread continued to increase at large levels. So it couldn't have been bars and restaurants that was leading that dramatic increase. Would you agree with that?
We saw the dramatic increase in cases happened before the county risk level metric went into place. We know that we were seeing cases associated with, we saw some outbreaks associated with restaurants, not a significant amount, and cases associated with social gatherings, but with upwards of 50% of people not reporting symptoms. They often reported getting together with friends and families in private settings, restaurants, bars, and other settings, and could not pin out specifically the transmission in bars and restaurants. And as those restrictions went into place, including on bars and restaurants with the county risk level framework, that's when we saw a flattening of the cases and then a decline in cases. We saw some contribution from our winter holidays here in Oregon, but again, not to the same extent that we saw in other states.
So that dramatic increase was not, I just want to say that most bars and restaurants were closed down. The dramatic increase continued for several weeks thereafter. And so that was because of other reasons, other community spread factors.
The dramatic increase in cases and the transmission happened before bars and restaurants were closed. And you can see that flattened around the time that the risk level metrics were put in place, which included restrictions on indoor dining. And so that increase did not occur after that.
Dr. Seidlinger, I have to tell you, our bars and restaurants were shut down in November, and our spike, the state of Oregon, continued well after that, and it was driven, I just want you to, it was driven not by bars and restaurants. There were many other factors that were driving it. That dramatic spread was, we can't blame bars and restaurants for that dramatic increase.
We saw a flattening of cases and not an increase throughout the months of November and December. I believe that those cases would have continued to increase at that same level we saw before the risk levels were put in place if restrictions on activities that matched up with the county risk level framework were not in place. Many other states that did not put in guidance and increased communication about limiting gatherings saw a much more significant increase in cases. Oregon continues to kind of lead the way in cases with low cases and death rates in the last 7 days and overall in this pandemic, and it's because of those restrictions that were in place. Otherwise, that dramatic increase that we saw through the month of November when bars and restaurants were open would have continued into the winter, and we would have been in a much different place right now and not talking about reopening additional activities.
But I just want you to acknowledge that we continue to see the dramatic shift, a dramatic increase while bars and restaurants were closed. I just don't want bars and restaurants to be blamed for that dramatic increase that happened, because
but bars and restaurants were open during the time we saw a dramatic increase that happened through the month of November. Beginning in November and through December, those cases flattened out and did not continue to increase. We saw a decrease following Thanksgiving and then an increase again following the holidays that came down dramatically in January. Bars, restaurants, indoor entertainment, indoor fitness activities, and even outdoor activities in these settings were curtailed during that, and that led to that flattening of cases that we saw through the winter.
Well, in my speaking with Executive Director Marks, I was under the understanding that we could trace back very few of our outbreaks to our bars and restaurants.
We do have few amounts of outbreaks traced back to bars and restaurants, and even less through the surge. During the surge, many businesses were closed to indoor activities, and our public health authorities also prioritized settings in outbreaks in congregate settings, as those cases were high through the month of November and December. So their resources were deployed to prevent hospitalizations and deaths in congregate settings like corrections, skilled nursing facilities, and other settings where disease spread rather quickly, including our food processing facilities.
And I want to follow up on a comment that Commissioner Floyd had made, and then in your conversation with her, it sounds like to me that, which is absolutely frightening, that bars and restaurants can expect to be operating at no more than 50% capacity and maybe less through the spring and summer and into the fall. And I hope that there can be a conversation that the damage, the sacrifice that these people are facing, there needs to be a risk assessment and a balance to what we are asking these people to sacrifice, sacrificing homes, food security, people who have expressed suicidal behavior because they don't have anywhere to turn. It's frightening to hear that this industry is going to be operating, and I think outdoor dining is great, but for them to lose, most of these restaurants thrive in the spring, summer, fall, and try and get by in that late fall, winter to get to this season. And we lost a whole nother season last year. And here we are knowing, we know so much more. What can we do? What kind of plan can we come up with so that the restaurants can open at least to 50% capacity and greater as we move on towards the vaccinations? Do we have a plan to do that?
Yeah, and I apologize if I misspoke. I said that I would anticipate increased capacity in these settings as we move through spring and summer, though likely not back to 100% capacity. That's as cases go down and vaccinations are in place. And so I do anticipate, increasing capacity. I think we will still have some restrictions, mask wearing when we can, when we're not actively eating and drinking, and some indoor capacity limits across settings. And Leah came on, and I don't know if she wants to help answer this question from the governor's office.
Good morning, everybody. Sorry to jump in. I'm Leah Horner. I'm Governor Brown's Jobs and Economy Policy Advisor. and have been working on the guidance and the reopening metrics alongside the Oregon Health Authority throughout the pandemic. I just want to acknowledge all of the questions and feedback that you all have been providing this morning. It's really helpful. And I just wanted to, and I think Dr. Seidlinger alluded to this, I just wanted to reassure you all that we are very committed to looking at the what's next scenario. And I think that all indications are pointing to probably loosening additional restrictions before we hit summer. And I don't want to overpromise, but I just want you all to know that I don't think, Commissioner, to your point, that I don't think that any of us have any intention of continuing to have these capacity restrictions going into the fall. And I think that we're even hopeful that we will expedite it even more than that. And so that is something that the governor is reviewing. As Dr. Seidlinger mentioned, we're looking at the new variants, the timelines associated with that, what the correlation to vaccination of individuals looks like. And so all of this is a construct that we are reviewing, and I'm very hopeful that we will have updated and revised information for you all shortly. Similar to, again, as Dr. Seidlinger mentioned, the increase that we saw in outdoor capacity. We're also reviewing some of that for indoor capacity as well, and then definitely looking at what's next. So I just wanted to paint a picture that it's probably sooner rather than later as part of this conversation.
I appreciate that because it feels like to the licensees who we're talking to that the minute we see an uptick, bam, everybody's closed. But the minute that we see weeks of dramatic decline, they don't see the reciprocal of allowing themselves to get some hope, to get back some of what they have lost. And I just don't know if, I look around, we are only as good sometimes as our common denominator. And we have people who are flying to our neighbors in Idaho, people who are flying, traveling, getting together. And I'm just not sure that the bars and restaurant closures or the lockdowns, even at the 25%, if that is effective at curbing a surge or curbing what we're trying to do here. And so I do, when we're looking at this, I'm asking for a conversation. I understand, Dr. Seidlinger, like I said, that it's helpful to hear this information, and we've been communicating this information for a year now. We've had a lot of this information now since June or July, and we've been able to communicate this to people. But what are we doing policy-wise that's balancing the very, very difficult sacrifices that we've had one industry make to the point of, like I said, I sent this in an email, I think, to Chair Rosenbaum, but people who are thinking of home foreclosures, bankruptcy, food insecurity with children at home. These are people who can't spend lots of money to get large outdoor seating areas. But they are committed to wearing masks, sanitizing everything, requiring their people to move in and follow the guidelines to minimize the risk, which is, I think, all that we can do is minimize the risk that we have with this. It doesn't matter. I've looked at what everybody has done and what countries have done, what states have done, and it just seems like we don't want to be on the extreme side of things where we are affecting bars and restaurants, closing businesses forever, permanently, leading people down financial suicide or physical or emotional problems. We're causing trauma to the bars and restaurant industry, trauma that was 2 weeks or a month or 2 months. But I feel like we need to consider that trauma when we we can do when we're moving forward in the realm that we are at. And I just hope that the message I get is that they feel like people are not being heard. My restaurant bar owners say, I'm not being heard. I've printed off new menus, and we sanitize everything, and we do everything. And I want to tell them, we're making all of these decisions to have a safe restaurant, but we aren't being heard because we still have these restrictions that keep us either from not operating or from moving forward. And then a further comment I would say is, I suspect that over 50% of restaurants are operating outside the bounds of what the governor's restrictions are. And part of leading is making sure that other people follow along. And the community, the bar and restaurant industry, in my opinion, has gotten to the point of rebellion. They are so desperate. They have no way out. And I'm not saying this because this is not a position I took except for a month ago when I was talking people off the edge 2 or 3 months ago. This is coming down to people surviving or not surviving. And when we're talking about that, food security, homelessness, emotional and physical well-being. And I just don't think we can ask more of them, more of this industry, without there being dire long-term effects that are not balanced now by the risks and, again, by the effectiveness of this policy. I went into the local restaurant for St. Patrick's Day yesterday. It was well over the capacity of the governor's limits. That's not coming into the statistics, but I would have rather, if we had a good policy that people could follow, that's going to be much more effective. I'm pleading, and I guess that's all I would say is, I am hoping, I'm trying to give voice to the people that are crying to us and saying, we feel hopeless. We feel like 3 months from now, if we're only operating at 50%, that's not going to be sufficient. They want to be able to put their safety measures in place and operate in place. They feel like they're being unfairly targeted and that there's not being a proper risk assessment done. And lastly, I would say, once again, this is not an effective method any longer to curb the spread. People are traveling, they are gathering in homes, they are having parties. I was on a Pendleton Chamber of Commerce meeting yesterday. They are bringing people to town for things in May, yet the restaurant industry is not going to be able to open and take place in that. We have to help everybody, and we have to help them open safely. And that's the message I would get to, is we need to let these people open safely.
Thank you, Commissioner. Is there any other commissioners that have any questions? Commissioner, is that Commissioner Rovell?
Yeah, it is.
Thank you.
Dr. Leah, thanks for coming. My questions are of a different vein. Doctor, a few years ago, science was telling us that we were sanitizing the hell out of the world and we were creating superbugs. So here we are, the last year and a half, sanitizing everything, but I don't hear anyone talking about the creation of superbugs, which kind of relates to me to the variants that are out there. You know, Mother Nature is a lot smarter than we are, and as we come up with new vaccinations, this virus mutates. So when I'm seeing the sanitation of America, I worry from past years when we were concerned about the creation of superbugs. Is any efforts being directed that way, or is there not a problem?
I will say, let me tackle the variant piece first, Commissioner. I think, most viruses, all viruses mutate as they replicate. This virus seems to have mutations that stick about every 2 weeks as it replicates. We've seen mutations in this virus from the start. For those who may recall, there was a large transmission event at a biotech conference in Boston that seems to have been linked to a potential mutation in one of the viruses. The mutations that we've seen most recently impact different parts of the virus that allow it to transmit more easily from person to person. Some that allow it to evade the immune system. So whether it's being reinfected after natural immunity or after vaccine. And so, the more the virus replicates, the more we see those mutations. And so that's why the vaccine itself and the other measures we have in place to prevent transmission is going to cut down on those mutations in the virus itself. We certainly do worry about superbugs, and that's particularly when we talk about superbugs, we usually think of bacteria. So whether it's from overuse or improper use of antibiotics, and even from antiseptic kind of cleaning materials and stuff, we can see changes in bacteria that can make them less susceptible to the antibiotics and the tools we have to kill them. And so there is a lot of work going on in that. And I think particularly with COVID, the rush to try and get more people vaccinated is to really try and prevent the rapid rise in mutations that are occurring so that we don't accumulate mutations that then render our current vaccinations and render the protection that people have after natural infection less effective.
So I kind of, at no joke intended, I see this as an ongoing vaccination from year to year. We're going to be looking at, like we do our flu vaccines and our pneumonia vaccines. This virus isn't something new, whether we want to go all the way back to the Spanish flu or go back to SARS or Legionnaire disease. It's all a virus of one nature or another. So we get tested and we're showed up negative to COVID-2, but this is COVID-19. So do you see this as an ongoing effort that we're involved in?
We may end up being in a situation where we receive a booster dose for COVID, if not annually, every few years. The coronavirus is a large family of viruses. Some of the coronaviruses cause the common colds, along with rhinoviruses and others. There are nuisance infections that we live with that don't cause serious infection. Two other coronaviruses that were much more serious, the the initial SARS virus from China that we saw limited spread throughout the world, particularly Toronto, our neighbors in the north were very impacted by this. And then MERS, or Middle East Respiratory Syndrome, are two coronaviruses that have high levels of complications and fatality, but luckily are not nearly as transmissible as the current SARS-CoV-2 virus that causes COVID-19. The 19 was chosen because that's when the first cases were identified. What makes this virus particularly challenging to control is that it's very easily transmissible, much more so than the flu. Not nearly as transmissible as an infection like measles, but fairly easily transmissible from person to person, including through the air. It does cause higher levels of complications than our common flu viruses do, and the fatality rate is higher than our common flu virus. So it has a combination of really easily transmissible, but also having a higher complication rate. When you add on to that the fact that many people don't have symptoms or have very mild symptoms, and even those with symptoms can transmit it beforehand, is how it was able to spread so quickly. So for now, the vaccines we have do seem to have an impact even on the variants that we're seeing from the Southern Hemisphere in controlling serious disease. But they're continuing to look to see if an additional booster or a change in vaccine that we may have to have down the road would have to be added to the schedule, but it's too early to know now.
So taking in the fact that, this particular one is far easier to transmit and has greater issues around or greater ability to kill, where does Oregon stand proportionally deaths versus total population? And how does that relate to other parts of the country? Are we higher, lower, less? With 4 million people.
So we have been lower when we look at rates. So our case rate from the start of this pandemic, we are the 4th lowest case rate among states and 5th lowest fatality rate among states during this past year. And our rates in the last 7 days have also been low. So I think we can be proud of the response that we've taken and the sacrifices people have made. We, are up there with some much smaller states and also our neighbors to the north in Washington, who've also been very successful at controlling this virus.
So I asked that question because, Leah, one of the things that I'm concerned with is that there's been an inconsistent policy, or from the people who come to us, no policy that's consistent whatsoever as to how we operate between spikes and closure. Now, if I stay specific with the restaurants, on Tuesday they buy new products and on Friday they're told to close. You can't do that. So how much of that is being related or replayed or relayed to the governor in an attempt to create a consistent policy on how we do? Because this past year has been a roller coaster for not only the business community, but the restaurant community, but the business community as a whole.
So I know in March, and I think even in November, we did have some unfortunate timing issues with announcements being made very close to when businesses were closed. With the county risk level framework, we vowed to give people more forward-leaning information, where we were going in trends, and as much notice as we could. We pull data every week, looking back on the 2 weeks, and use 1 week as a warning week so people can see where they are. See if their county is trending up or trending down, start to think about what the following week could look like. Then we pull the data again the following week, and Leah gets the opportunity to make calls to county commissioners, some with good news as their rates have come down, some not so good news as their rates have come up, so that announcements can be made early in the week, typically on Tuesdays, for effect on Fridays. With that, as we've seen, significant number of counties move down in risk and continue to move down in risk. So that's been great. That shows that we allow increased activities as rates go down, and businesses can plan for that as they see the trends. We've seen some counties that just kind of came below the line and then went back up the following 2-week period. And so we even instituted another period where once counties move down, they have at least 4 weeks down in the risk that they go down to before they could move up if that trend is not sustainable. So we've tried to build in as much notice as we could for businesses, knowing that the planning and the purchases have to happen ahead of time. I don't know if Leah wants to add in or capture that.
No, I think you capture that. And I just also want to just point out, I know that the system is not even close to perfect, right? And I'll acknowledge that. But I also just want to indicate that we have been in communications with Orla throughout this whole process. As Dr. Seidlinger mentioned, in March, the closures and not giving enough time, they were telling us, 2 days is not enough. And so we really, we did take that to heart. That's why we instituted the warning weeks. That's why we instituted the buffers, so that restaurants were not seeing that toggle. So it may all look like a blur, but some of this really was practically based on feedback that we got directly from bars and restaurants. And so again, I know it's not perfect. I know it's not what everybody wants, but we have listened to feedback.
Well, I bring this up because, I'm watching the national news and we're talking about Oregon. Oregon is one of those states that's a 14% increase. I'm going, what the heck? Now, I thought we're going down, then the national people said we're going back up. And I guess for both of you, it is, Doctor, do you expect to see substantial death rates and hospitalizations in states such as Texas and Florida, who's taken all the precautions away in the next 60 days?
I do expect to see that, and I think they're already seeing some of that initial increase in cases in Texas, I know in particular, as restrictions have been eased, and particularly the mask mandate as well as any capacity limit. Yes, I would anticipate that.
And Leah, the national situation is different than the state situation. And I get worried when I see national news media that says that we're experiencing a 14% increase. And of course, that's not what I'm seeing in the state's documents. As I worry that the information going to the governor's office will lead to another shutdown based on information that may not be truthful that applies to this state. So, and how do we deal with the fact that we're going to be in this constant booster shot position for the next several years as we create either a superbug or we have different forms of this mutated virus, because this is just simply not going to go away this year, and we will have vaccinations ongoing.
Yeah, thank you for that. I just want to reassure you that we are following the state data. The governor meets with the Oregon Health Authority and gets daily updates on kind of where we are as a state. So I'm not quite sure what the national numbers are coming from that indicate that 14% increase, but we're very much monitoring this both on a day-to-day and a week-by-week, and then as Dr. Seidlinger mentioned, also in correlation with how the modeling comes out. So everything that we're looking at is pretty real time, and the governor's making decisions based on all of that data. I think as far as long-term goes, I think there becomes kind of this saturation point where we kind of have to figure out the what's next. And I don't want to correlate to the flu, but I will say that there becomes a point in time where we kind of have to, we know that we can't live in this perpetual state of metrics forever. And so I think that that's really what we're trying to balance is, both the public health needs, the economic needs, but also knowing that we as a state have to move forward. And quite frankly, even though this has been such a challenge, as a state, Oregonians have done a really good job at this. And so I think that is really something that we acknowledge, the governor acknowledges, and we're trying to kind of figure out the what's next.
And don't get me wrong, thank you. Don't get me wrong, but I equate this with flu. I equate this more to a hell of a case of pneumonia on steroids, and just someone who's had pneumonia several times, and I look at the patients and what they were on and what I was on, it's not going to go away. So I appreciate the fact that you're going to look at what's going to happen down the road, that this is going to continue, and that we can't just keep reliving this nightmare. Thank you, Commissioner. Thank you, Chair.
Thank you. Commissioners, any other comments before we move on? Okay, I have one quick question, Dr. Seidlinger. Your first slide, you had a gray area that was designated as unknown hospital status. Just for my curiosity, would you please tell me what that means?
So during the surge with the case investigation and contact tracing, our local public health prioritized follow-up in certain settings, primarily congregate living, congregate work facilities, and other places where disease transmits more. So those large gray bars during the surge were cases that weren't fully followed up on, were given instructions about isolation and quarantine, but did not have the regular full case investigation that has happened at other times.
Okay, thank you. Listen, I thank you very much, Doctor. I thank the governor's office as well. Our agency is a regulatory agency that first and foremost has the interest of the general public at heart. That's what we're here for. We have to have protection for them. At the same time, it's no secret that this agency is very much concerned about the interest of business owners that make up the agency. It's part of it. There's very few times that those two do not mesh together. And I think from all of the comments that you've heard, there's a tremendous concern for both the protection of the public and the protection of the business. That's not going away. And Doctor and the governor's office, you both, without a doubt, realize the intensity of what's going on here. And what I would suggest, if it's okay with both of you, is that you make your numbers and your information available to all the commissioners. And if any one of them needs to reach you in terms of what particularly is going on within their community, If you agree, I would appreciate that we have that access to you directly. I think that would be important as well. Doctor, is that okay?
Sure. I am available and happy to try and answer questions or refer you to someone who can answer those questions better. That may not be me.
And the governor's office, is that okay as well?
So, yes, I mean, you're welcome to contact us. Jeff, I would love to just connect Jeff into some of these inquiries.
Well, he will
yes.
be. He not only will he, of course he will be. That's a given. We go through Jeff on just about everything. So I'm just thinking that to wrap up this section, if the commissioners have direct access to you, they won't annoy you, but I think it's important that they have access to you. And I thank you for that. And Laura, will you make sure that that happens?
I will, yes.
Okay, thank you. And thank you both for being here. This was very enlightening and we do appreciate it. Thank you. Okay. Rosie, you're up on 2021 legislative briefing. Yeah, it's a tough act to follow, but I'm sure you'll do well.
I'll try to make it as fast and just run through most of the legislation I'll talk about today are bills that are scheduled either for public hearing or work session between this week and the first week of April. I'll start out with the Chair Rosenbaum, Rosie Shatkin, Government Relations Manager for OLCC. So the bills I'll start out with is all of the marijuana policy bills. We have a number of bills that we've been working very closely with Chair Wilde for the General Government Committee, and he's been extraordinary in allowing us to make some technical changes. As we've heard, due to COVID, there are a number of things that are happening to our licensees. I'm going to start out with House Bill 2263, and that's a bill Legislative Council is working with us on metric system and ensuring that we're looking at the cost of tracking. And so Director Marks is also working with some of the stakeholders in making sure that we have the proper language for that bill. On House Bill 2265, the bill is scheduled for a public hearing next week. That's also a placeholder that Representative Lively and Representative Wilde have afforded us to have our medical marijuana language in that bill. It was something that we'd worked with the governor's office on, and it was not drafted through the governor's office, but the placeholder is now in that bill. We've got a couple of amendments out to ensure that we are establishing rules that OLCC will have for medical marijuana growers and grow sites. The other bill, there are a couple of other bills, 2519, that's moving, doesn't have any direct impact on us. House Bill 3112, that is the equity bill, and it is scheduled, was scheduled earlier this week. Director Marks is scheduled to testify on the bill for next week. And this initially was through OLCC, Legislative Concept 668. We were working on our own draft for a coordinating with other agency to establish a equity program. But due to the work with the equity group, they've collaborated and worked on legislation. So our bill was no longer needed. But Director Marks will testify on that next week on the provisions that relates to us. 3197, that is a bill from Representative Marsh Representative Marsh worked closely with OLCC to draft language dealing with worker permit. The language also, the bill also include some technical fixes from a constituent that of hers from Southern Oregon. That bill is also scheduled for a hearing, and Director Marsh will also be testifying on that bill. We have a bill coming up, House Bill 3239. There are some challenges with the bill. We will testify and highlight some of the issues and try to work with the legislators on how to move that one forward, if they so choose. The final bill, there are a couple of other bills that are, I think they did have a public hearing. They will be scheduled for a work session. We're not quite sure whether the bills will move or not. There are some challenges, constitutional challenges with the bill, and whether or not we can, state can implement what's required. The final bill is a placeholder, Senate Bill 808. It's scheduled for a work session, public hearing. I've reached out to Senator Przonski to determine whether or not he would, there's anything that he would like OLCC to work on with his staff in the committee. It's a Judiciary and Ballot Measure 110 Implementation Committee. And so that bill is scheduled for next week. And that's the list of the cannabis measures. For the alcohol bill, I think we're calling it the Croy Amendments. Dan Croy, who's been here for a number of years, have put together a list of technical fixes due in part to COVID and also outstanding issues that has been laying around but haven't really been addressed. And for example, one of them is the alignment with federal statute on the definition of malt beverage. Another issue is the outdated use of kegs. And so that bill also includes a couple of our legislative concept and bills that Chair Wilde, at the request of the speaker, to put like-minded bills together so they can move faster in light of COVID and addressing topics that are not controversial. So that would be House Bill 2264, and it's scheduled for a public hearing today. The director will be testifying on that, and a work session next week. We also were able to work with a few of the legislators on House Bill 2363. That is to help a lot of our local nonprofits be able to move the products from different locations. And again, that's really a technical fix and not too many controversy around that bill. And it's likely will move out of committee this week and heading to the floor for a vote. House Bill 2640, that one is also moving. Representative Leaf's bill, that is on issues of, 2640 is actually Representative Post's bill. 2740 is Representative Leaf's bill. It's scheduled, 2640 is scheduled for a work session next week. We have not testified on that bill, and we've not been asked to testify. 2742 is Representative Leaf's bill, and that bill is actually being carried over. It carried over this week, but it likely will be on the floor next week. And 2758, that is the bill that would add at least 2 commissioners to OLCC to have a public health background. There's an amendment to reduce that to 1 commissioner with a public health background. It's scheduled for a, it was carried over for next week and scheduled for a public hearing and work session on the 23rd. Any questions so far?
Commissioners?
Chair, Commissioner Harper here.
Go ahead, Commissioner.
Thank you. You didn't mention the House Bill 3252 or House Bill 3253 in regard to the transportation of marijuana from state to state. Do you have any update on that? And then the last question is, in regards to these House bills, do they produce a fiscal response to if they are approved or not to each one of these bills?
Commissioner, Chair Rosenbaum, Commissioner Harper, most definitely. I'll take the last question first. There will be a fiscal request to OLCC should any of these bills moving out of committee. So there will be a request. As to 3252 and 3253, they're both sponsored by Representative Brock Smith. He did testify on both measures, and whether or not it can be allowed, I think there are discussions around that currently.
Okay, so they will both be dropped. And what's that taken out? What's the date that these bills will be, I forgot the term, but they don't go forward in regards to each one of these bills?
So many of these bills that we're looking at right now, they're scheduled for a work session. So they've had a public hearing, or they're scheduled for a public hearing and work session. So the work session, if a bill is not scheduled by March 19th, that's tomorrow, for a work session, then the bill no longer can move forward. It dies in committee.
Thank you, thank you, thank you. And I forgot my last question. It was, you talked about transportation, and then you told me about fiscal. So thank you so much.
No worries, thank you.
Any other questions?
Chair, Commissioner Miletus here. Rosie, are we tracking, and I just read about it in the paper, but SB 339, it's the state bank bill. I know it's not technically, I mean, it's not technically alcohol or cannabis, but I think it would have big implications if it were to go through for the industry that's, underbanked. Are we engaged on that one at all?
We have not been engaged on Senate Bill 339. I will certainly follow it after today.
Yeah, no, it seems like an interesting one. I just it would have some positive benefits if the cannabis industry was able to be banked. So yeah, just maybe worth tracking. Thank you so much for everything. Great job.
Thank you.
I have one comment. Thank you very much. This is a new process for you and for us in terms of your presentations. I'm vitally interested, as you well know, and I'm sure the other commissioners are interested in the legislation that would add 2 commissioners to the agency. I am vitally interested in any piece of legislation that would seriously affect the agency from a fiscal point of view. And there are commissioners that I think during their work process come across bills that they are particularly interested, i.e. just Commissioner Miletus and his latest comment. I would suggest, Will Rogers had a famous statement. He said, if you like good sausage and good legislation, you shouldn't be around when either's being made. So there's hundreds of bills that are in a working session. And I would encourage any commissioner that if they have a particular piece of legislation, they contact Rosie and ask her to talk about it at the next commission meeting, which I think would be very germane. She knows I tell her which ones I'm interested in, and I think if the bill is just in a working session and there's not too much of a chance to come out, I don't think the commission is particularly interested in that, but we are interested in everything that where we're going to have a say or be affected by. So next month, will you please keep that in mind when we're talking about these stuff? I think those are the ones that we're really interested in.
Most definitely. And a lot of these bills are in working session. With a working session, the likelihood of a bill moving forward increases. So this is the reason for the presentation on these particular bills. There are a number of bills that don't have a work session, but a work session is important aspect that if we do have something that we want to add or share with the legislators, it is a good time to share those comments.
No, I totally agree with you. You'll know what we're interested in. I have no doubt about that. Okay, thank you so much. I appreciate it.
Very much appreciate time. Thank you.
Thank you. Chris, you're up on warehouse update.
Oh, good morning, Chairman. Good morning,
Good morning.
Commissioners. Hopefully you can hear me okay.
We can hear you fine.
Perfect. For the record, my name is Chris Mayton. I'm the Distilled Spirits Program Director for the OLCC. I'm here today to give you our monthly update on the warehouse. From a project perspective, we continue to work with the legislator, as Rosie just mentioned, to gain budget approval for the warehouse relocation. Mostly though is all the work that's going on behind that. Currently, we're working with DAS to properly select a professional service provider, which we would be calling a third-party project management firm, to help with our planning purposes. They'll bring expertise to consult us on a wide variety of services to include architectural, engineering, design, construction. We've also continued to work on a request for information for the new building site location, and it's in draft form. We're getting closer to release on that, and we're working assiduously to finalize it. The conveyor RFI for the new building was recently completed. It had 21 interested companies in it, so that was great news for our department. Other than that, our retail services director, Brian Fleming, and his team continue to work on our next phase of retail store expansion, while our distribution and purchasing director, Nikki Leslie, continue to find and create space where needed to keep our products in stock as you know, we continue in our existing building. And all divisions are still working to document their unique specifications in preparation for a detailed RFP, or request for a proposal, later this year. With that, that concludes, and I'm here to answer any questions for you.
The floor is open.
Chair, it's Commissioner Miletus. Chris, we did the conveyor RFI before we did like the site, so because I mean, and maybe I'm missing it, but wouldn't that be like maybe something we did after we figured out the location, or what was the thinking behind doing the conveyor RFI first?
Chairman, Commissioner Miletus, that's a great question. Really, the thinking behind that was just to understand what's out in the marketplace for conveyor systems. We know we have a conveyor that's currently only 6 years old, so we believe we have the ideas of what we want, but we just wanted to make sure we knew all the unknowns were out there. And with that, once we determine what the level of technology is available to us, we can work with the architects and engineer to design what we need in the new building once that is set forth.
Good thinking. Thank you, Chris.
Any other questions? Chris, I'm going to leave you with one thing. Director Marks and I have talked about this before. Listen, this warehouse, whether we like it or not, is directly related to the future success of this agency, period. And my point to you, very, very cogently, is get every penny you can for this warehouse in this session, because we don't want to scrimp on this. This needs to be done in a way that we have 100% everything we need, because the direct connection between revenue success and the future of this agency is going to be depending on that warehouse. So we should not scrimp on this thing.
Message received loud and clear. I couldn't agree more with you, sir. Thank you.
Okay. Okay, we're up to my favorite person in the agency. Nikki, where are you?
I'm here.
Where?
Good
Oh,
morning.
there you are.
I'm here. Good morning, Chairman Baum and Commissioners. For the record, I'm Nikki Leslie, Distribution and Purchasing Director. I'm here today to present before the Commission the product activity for the month of December, January, and February. And it was a busy month, past 3 months for us. So under tab 1, you'll find the detailed product list activity during this period. And staff recommend the commissioner confirm the 65 item on the list. So we need those big warehouses to fill all these products.
Commissioners, any questions? If not, I need a motion, please.
Chair, Commissioner Harper here.
Thank you, Commissioner.
I move to confirm the 65 items for December, January, and February.
Okay.
Commissioner Curran,
Yes.
Commissioner Floyd,
Yes.
Commissioner Harper,
Yes.
Commissioner Molinas,
Yes.
Commissioner Pasek,
Yes.
Commissioner Raval,
Yes.
Chair Rosenbaum.
Yes. Nikki, thank you so much. I appreciate it.
Thank you.
Okay, moving right along. We have now our second most favorite person in the agency. The agent store appointments. Brian, do you want to say anything before we get started?
I'd just like to thank you for at least coming in second place. And he first, me second, and at least the recognition. We appreciate it. I will start out, since you asked, as we have a great deal of interest in the current expansion model in Portland. We're working a lot of the district managers one-on-one with the site. So we've already got 4 or 5 applications received. As you know, the deadline is on Monday, the 22nd, for receiving applications. They must be in by 5 p.m. And then we'll begin to do the evaluation. We hope to bring all of this before the May Commission meeting, which is a Thursday before Memorial Day weekend. And so no, this could take some time. But this will be the prelude to what's coming up, because this is our first competitive recruitment. We've done a couple of spouse childs with you, but we will see how this goes. Lastly, revenue volume's off a little bit in March. As you know, we were up significantly last year, and now Mr. Mayton is tasking us with, well, why are you behind? Why are you behind? Well, we had a beginning of a pandemic and pantry loading, but all kidding aside, the bars are starting to see some growth again. We're close to 90%, 95% off last year, and now we're starting to see more like 40 and 50% decreases, which, believe it or not, is good news. So thank you. I will, Chair Rosenbaum, Commissioners, for the record, my apologies, Brian Fleming, Director of Retail Services. Before we get started, I have 2 of the applicants that are on the phone. They have internet service provider issues. They're continuing to try and dial in. However, they are on the phone, and I'll probably assist Laura with next slide, or others can do so. I believe that they have that in front of them. So this may be a tidbit clunky, but they don't have the control of their internet service provider. So with that said, if you don't mind, I'll jump in. This is for store number 1011, Ontario, Oregon, approximately $2.3 million in sales annually. We have 3 applicants before you today. This is the result of Kenton Anderson resigning or retiring. He's been with us for 25 years in the city of Ontario. Mr. Marks will work to get the plaque down to you somehow to do the signature. As you know, we try to recognize those extended years of service, but we'll work with you over the next few days to get that so Graham can deliver it. With that said, we're going to get started. Should you have questions with materials in front of you, I'm following along as well. Their business plans have been submitted to Laura, and she's going to take over the screen. And first up, we're going to start with Kevin Munoz. Kevin, if I've hurt your last name, my apologies. Please introduce yourself. All of the applicants today, state your name for the record. And introduce yourself. We'll have 5 to 7 minutes to go through each presentation, and then we'll go into deliberations. Thank you.
Thank you, Brian.
Kevin, are you there? If you're on your cell phone, Kevin, please unmute your phone. Okay, let's try one last time for Kevin. Kevin, are you here? I think in the spirit of time, we will move on to the next one. I know Graham Alderson is on the phone. I'll let him give a few minutes to try and reach the other applicants. So with that said, we'll go to your second tab.
Pardon the interruption. Both of the candidates who have internet interruption are telling me that they cannot unmute on their phones for whatever reason.
Laura, any suggestions?
Try *6.
That worked.
Okay,
hello, everyone.
So, Kevin, are you on the phone now currently?
I am currently now on.
Oh, great. Laura, the lifesaver of the day as always. So with that said, Kevin, please get started. Like I said, 5 to 7 minutes. Introduce yourself for the record and take us through your plan.
Can do. Hello, everyone. I'm Kevin Munoz. I just wanted to start off by thanking you today for your time, as well as thanking you for the opportunity to apply as a retail liquor agent for the position of Store 1011 as the Ontario Liquor Store. Next slide, please. I've broken down my presentation into 3 separate categories, starting off with a little bit of background history about myself, moving on to short-term plans that I have for the business, as well as long-term plans that I have moving forward with it. Next slide, please. I was born and raised in the general area. At the age of 17, I enlisted into the Idaho Army National Guard. The summer of my senior year of high school, I attended my basic training, completed that, returned to high school, graduated from high school, and then moved forward with my advanced individual training as a 15 Romeo, which is an Apache mechanic. And from there, I completed that as a distinguished honor grad. Next slide, please. Once I returned, I wasn't quite too sure the path that I was going to be taking. Something my parents had always instilled into me was the need of a higher education, because they weren't given that opportunity themselves while they were growing up. So that following fall of 2015, I had enrolled into TVCC. Wasn't quite too sure. I didn't have a major when I had enrolled, but I did know that I needed a part-time job to help pay for college while I was doing it. And then, so I acquired a part-time job at the Ontario Liquor Store. Without actually having a decided major, I realized that maybe college wasn't the path that I needed to be on at that point in time in my life. So I put that on pause to continue to work at the Ontario Liquor Store. About a year or two later, I'd been approached by Burt's Growler Garage for a part-time position because of my great customer service and my approachability that I'd shown while working at the Ontario Liquor Store. About a year later, I had received notice that I was going to be deploying to Kandahar, Afghanistan with the Idaho Army National Guard. Upon my return, I came back to both my civilian job as well as continuing on with the Idaho Army National Guard. A few hobbies that I have, I quite enjoy anything that's just outdoors, fishing whenever I have an opportunity to. Working out, I try to do that about about every day. And I included work into the hobbies because it's something that takes up most of my time, and it's something that I'm quite passionate about. Next slide, please. Short-term plans that I have for the business itself. I would like to convert all the halogen lighting that we currently have to LED lighting to better showcase and display the products that we carry. Moving on from that, I would like to get an updated canvas sign for the outside. The one that we currently have has become quite antiquated, and it's starting to show its age. I have included an Excel spreadsheet with the presentation itself to have more financial backing on the estimated cost, which I estimate to be around $10,000. And I plan to complete this within the first year of me becoming the OLCC agent. Next slide, please. Another short-term plan that I have is going to be to replace the current shelving. As you can see by these pictures that I've included in the presentation itself, they aren't quite up to the standards that I would like them to be, especially as an OLCC agent. Next slide, please. Currently on this slide, I have the dimensions of what the current shelvings are and the proposed dimensions that I would like for them. As you can see, the only real differentiation that I have between the two is going to be the proposed depth, and the reason for that being is I would like to be able to hold more inventory out on the floor versus having it in the back room. I estimate this to be at a cost of around $50,000. And I plan on completing this within 2 to 3 years. The reason it's not being any sooner is because I would like to dedicate the first year more or less to be able to run the business more efficiently. Next slide, please. Long-term plans that I have for the business itself is eventually find a different venue. The current venue that we have isn't quite meeting the demand that we are receiving. And I would like to be able to increase the inventory space, as well as if you've ever been to the Ontario liquor store, you know more or less that the parking situation is not ideal. And it's one of the many complaints that we get on a regular basis. And I would also like to be able to move it to a more centralized location in Ontario, which in theory would be able to solve the inventory space issue as well as the inadequate parking that we currently have. I began at the Ontario liquor store at the age of 19. I've seen how much it's grown since, and I would like to be a part of expanding and growing it beyond that. Next slide, please. I just want to take this time again to thank you for the opportunity as well as your time today. Are there any questions?
Mr. Chair.
Go ahead.
This is Commissioner Palcic. I thank you for the presentation. 53 hours I read. You want to maintain the 53 hours of work. How do you arrive at 53?
I just took into account the actual time that we were open, Monday through Sunday. Most of the time right now, the way I have my work schedule set up, because I have 2 jobs as well as the Idaho Army National Guard, I already work usually more than that. Being able to solely focus on just the liquor store itself will make it a little bit easier, and I will still be able to do around the 53 hours. But like I said, right now, most of the time, I got that number specifically just from the hours of operation.
Thank you. I was just curious more than anything else on that, and so I was just how you arrived at that. Thank you for that. And your hobby is work. That's passion right there for you. I must say, hats off to you. I will say, just on my own, I would suggest anyone find a different hobby, but that's a whole nother thing. Thank you for the presentation.
Thank you for your time.
Okay, so that went better than expected with being on the phone. Thank you, Laura, for guiding us.
Brian,
go ahead.
Brian,
Yes,
Chair
sir.
Rosenbaum, Commissioner Harper, I have a question.
Yes, sir.
Kevin, I noted here that you said you started working at the current liquor store at the age of 19, but it says you're the assistant manager from November 15 to current. So that means you're currently now just 24 years old?
Currently 24, no. Currently 25, it's going to be 26 this year.
Okay, so in regard to your business background, is the only business background you have is as being an assistant manager fiscally?
That is correct.
And
That is
then
correct. I'm
also,
being assistant manager at this specific store.
okay, and the great thing, you know, from Portland is, or West Lynn, it's 5 hours and 39 minutes to drive to your office. So you know you probably won't see me too often. But I had a question. It says you're the, I looked on Wikipedia and it says you're, you know, on the Idaho border. In relationships to the people coming from Idaho and you servicing the citizens of Oregon, is it traffic pretty heavy, or is it pretty light in regards to state purchasing?
Traffic itself, it's really dependent on the products themselves. We do see a lot of customers from Idaho themselves coming in for products that they can't find in their area, such as like Everclear or similar items, or similar harder to find items in their area, like Eagle Rare and things like that. Just items that they can't get in their area, or that they have to jump through more hoops to be able to get to where we'd be able to acquire it for them a lot easier.
Oh, excellent. You sound really mature. And my last question is, what's your relationship with youth groups and our health organizations in Malheur County? Do you feel that you need to have a relationship with those groups in regards to the sale of alcohol?
Could you repeat the first half of that question? I didn't quite catch it.
Do you have a relationship with current youth groups or, you know, schools in your city? And do you have a relationship with the health organizations that work with people that could be afflicted with the overusage of alcohol?
Currently, at the moment, I do not. Once I graduated high school, I did help out with the school that I had gone, or that I had attended, just with just like wrestling programs, things like that, because I was quite into the sports at the time, and I just like seeing the people that I had grown up with and that I had trained with mature as adults as well. Health organizations, I have not done too much with at the moment.
All right. Hey, thank you, Kevin. Thank you, Brian, and thank you, Chair.
Hey, Brian. Oh, go ahead, Commissioner Curran.
Oh, I was just going to ask one question. I've actually driven by the liquor store down there. So Kevin, I had a question about, have you located, you talked about moving it, and I was curious about, have you done any research or located another venue for the current liquor store?
I have not found anything as of right now. I've done a little bit of research, but not as much as I necessarily should have. But I plan on moving it within, or around year 5 or 6 if possible, if something is available to where it would fit the criteria that I was looking for.
Thank you.
Brian, Chair, I've got a quick question. Kevin, thank you. Kevin, first and foremost, I just want to say thank you for your service. Thank you for your service and your time. So just a quick question in regards to, it looks like you're working currently with the SBA to secure a loan for financing. Where is this at? Is it in the finalization process? And if you were to be awarded the store, will you have immediate, financing that you'll need? Should you be appointed?
Currently, I didn't mean to cut you off. I'm sorry. So currently, I have it under. It's currently in the underwriting. The only thing I'm waiting on is for the business tax returns from the current owner, which I had talked to him previously about acquiring prior to the actual meeting, and he said he'd be more comfortable giving that information once I'd been appointed agent, if I was so lucky to get appointed agent. So currently, I am confident enough that if I am appointed agent within 5 to 7 roughly days, I will be able to have a letter of guarantee for the funding itself.
Okay, thank you.
My apologies, commissioners. I'm going mute and unmute. I have a goose fight happening above me that is extremely loud. So with that, geese are all abound on top of my office today. With that, I will bring up our first and foremost, any other questions? Thank you. Our next applicant, I hope I get the name correct, is Tiana Peterson. Tiana, are you ready?
I am ready, if you are ready.
Yep. Laura will pull up the presentation.
Can I just say one thing? So during this presentation, there is going to be a little video. So I'll have to go out of this into the video and then back into this. So bear with me. Thanks.
And thank you for doing that. I appreciate it.
No worries.
So good morning, Mr. Chairman and Commissioners. I appreciate the time you are taking today to listen to my proposal on the Ontario Liquor Store 1011. Next slide, please.
Please introduce yourself.
Oh, I'm sorry. My name is Tiana Peterson.
Perfect. Thank you.
Sorry. A little bit about me. As I was growing up, my parents ran a convenience store. So as early as age 7, I was stocking shelves, first in, first out, and had all the terrible jobs that I thought were fun, and everybody else just made me do them. I then worked at Burger West for 6 years and was a supervisor there for most of those years. My current position, my title is District Manager at the Ontario Taco Time. I started there in 1990, so I've had several titles. At one time we had 4 stores and I oversaw those 4 stores. Currently, we only have 2 stores, so my main position at this time is to run and operate the Ontario Taco Time. I do a little overseeing of the LeGrand store, but mostly my main focus is the Ontario store, where I do all the training, management, human resource files. I manage all the labor costs. I send in all the payroll. We do the scheduling, all aspects of the handling of the cash to get it into the bank. And I make sure the store stays in compliance with all local, state, and the franchise regulations. Next slide, please. Welcome to Ontario. We are a border town. Our nighttime population is approximately 11,000. During the day, we have a daily influx of up to 60,000 people with a service area of 80,000. It's my experience that a large number of these people stay on the east side of town where they are coming in and shopping at the Walmart. And we'll get to that a little bit later when I talk about possibly moving like the location. Next slide, please. I would plan currently to maintain the hours of operation, which are Monday through Saturday, 11 to 7, and Sunday, 12 to 5. I also will love to maintain as many employees that would like to be a part of my team. I plan on updating some of the curb appeal and engaging in community and being in community involved. Next slide, please. I feel employees are some of our best assets, and providing continuing education will be one of my main focuses. I have had a friend that perished in a, drunk driving accident, and I feel if the server at the time would have had more education, that maybe could have been avoided. And so that would be one of my really main priorities. I will also give my employees the tools that they need to help educate the customers as far as ingredients and drinks and specials, because I feel as employees of something like this, it's our job to represent those people that put all their blood, sweat, and tears to get their product into that liquor store. It takes a lot. It's not just a bottle on the shelf. There's a lot of learning and a lot of work that goes to that. And my employees need to be able to back them up and be the best they can be and represent their products for them. I also will be providing training, on how to handle a difficult customer and difficult situations. I've dealt with a lot, and I feel that as much training and preparedness you can give an employee, it helps take those situations down a notch. I will create a positive work environment. That's what I do now where I'm at. And I am very lucky to say I have several crew members that have been with me between 7 and 20 years because we work as a team and we get things done. Next slide will be your video.
It should take just a second. Laura already rehearsed this, so I have great confidence in her.
And if we can't get it, it's okay. I've got backup slides. It should have an audio with it.
You can't hear the video?
I can't on my end, no.
Okay, give me 1 second, okay? Because I know how to do it. It just...
Okay, and if it's too much, I can support it with slides, either way.
You tell me what you want to do.
It's up to the commissioners if they'd like to continue on, we can.
Maybe we can give Laura just a few more seconds to give it a shot.
Yeah, let's give her a couple of more seconds to give her a shot.
We're all working virtually, so visual is pretty good.
Okay, folks, it's not working. It worked in the test. I mean, I can get it to work, but now I'm nervous.
That's okay. We can continue on without it and maybe we can pop it up toward the end or something. So the video that was made was to introduce you to the Ontario liquor store and the proximity of how it's all set up and the current shelving. Its current location is small. It's 2,000 square feet and approximately, not quite, but about half of that is front and half is back. It only has 4 parking spaces out front, which the footprint of the building cannot be changed. There is a small alleyway there that if you could do something with the parking, you could increase your square footage on your building, but the parking cannot be changed. It's grandfathered in now. It doesn't actually have required parking for if it had been built in a later time. It has been grandfathered in for that parking. So one of my things for a long-term goal would be to find a different location that has easier parking, better access. That would be down the road. I really feel it would thrive on the east side of town where all of those Idaho people are coming across to our Walmarts and our Waremarts and all of that. That other side of town just has this crazy influxion that happens every single day. So that would be a long-term goal. For my short-term goal, I would like to update, and I think if you want to catch up, we could just go back to the slides and catch up to the undermount lighting slide.
Did you say it's backwards or forward?
No, if you want, or go forward, I'm sorry.
Okay. Keep going.
Yeah.
Okay.
That's the slide I just was talking about there with the long-term parking being addressed with a new location. And then this one is the undermount lighting. On the video, I showed that the counters are the way the shelving is done is dark. We visited a store that had this undermount lighting, and it really makes the product pop. And the lights can be changed to change the mood in the store to a more festive or slower, however you want to do it. So I'd like to do that with all of the shelving for the liquor. Down below, there is the first counter on the left-hand side is what is there now. I would like to change it up to more of a rustic industrial look so that we can kind of incorporate a new filling and a new filling of warmth in the business, in the building. Next page, please. Next slide, there we go. I will create a Oregon point of interest. We have a lot of amazing products that are made here in Oregon, and I'd like to highlight them so people know what they are and a little bit about them when they purchase them. Also display seasonal specials and products that can get people excited, like what's new this Christmas, what's going to be the end drink, and then provide them the products to do those things, and recipes also to make that new exciting end drink. I think it's important to make sure that you always have something new to offer people. It gets that point of interest as they come in the door. We may be able to push the back storage wall back, or the back wall of the liquor back into the storage. So that would give us a little bit more room where we could create those points. And the city is okay with us changing the inside footprint, but we cannot change the outside footprint of the business. Next slide, please. My ultimate goal is to maintain tradition for the regulars while keeping up with new trends. Again, like I said, our town is a very big mix of the good old farmer boys with the new influx of all the people that are into the wines and getting excited about that next new product. So we want to try to make sure we capture all of that and put that to work for us. Next slide, please. I do plan on joining the Chamber of Commerce. I've been a member before, but working in food service, it's very hard to leave for the chamber meeting at noon. So I'd like to revitalize that relationship. I will participate in local events and promote community education. I'm already involved with our library. There are summer reading programs and events that they offer, and they are very involved with the Boys and Girls Club, which I feel targets a very good group of the kids are awesome, and this is just the perfect time to reach out to them and start teaching them the dangers so that they don't lose a friend in an accident like I did. It's devastating. Next slide, please. In my statement of funding on my original application, I have enough funds available to do all of the immediate proposed changes, and I have additional funding that I've been working on for the long-term goal of moving the business. I have looked in the area to move over to that more active area. Of course, the rent is extremely high, and the availability is a difficult thing. So that would definitely have to be something that we can work on and reach out to people. And as things move and come and go, we can get that relocated. I did help my current business that I work at was over closer to the current liquor store, and I was a part of helping to relocate that. And the sales, I can't give out sales numbers exactly, but I can tell you it was the best move my owner ever made. Next slide, please. It takes a village, and in my case, if you pick me to be the your next agent, you get a village. I come with a husband that is semi-retired, and he needs something to do, whether he thinks so or not. I think he needs a lot to do. He has experience in retail and farming. He's ran his own business for many, many years and done it very successfully. And he backs me up in my current career, so I know that we would be a good team for this. I also have a young lady that has worked 14 years in retail, and she's done displays and shelf setting and those kind of things that take a little bit of a knack, I think, to make it look the way it should to attract those people there. So thank you for your time, and sorry the video didn't work. It might be able to see it later, I'm not sure. Any questions?
Commissioners?
Chair Rosenbaum, Director Fleming, Commissioner Harper here.
Commissioner?
Thank you. John, I'm real excited because you took away some of the questions I was going to ask in regards to relationships with youth groups and Chamber of Commerce, which is vital, local events, and the promotion of community education and working with law enforcement. A couple of things that are active in our stores is security, high-speed internet, technology. I did not see a lottery in that store. Does it have a lottery display and able to purchase lottery tickets?
It does not currently have a lottery, and I did not put that in my proposal, but I have already started investigating what that might involve.
Thank you. And I was excited to hear about your team. Our first presenter talking about being coachable, and you're coming in with having a husband. So that is exceptional for me. My last question again, as always, is the financial side, and you had mentioned that you have the funds available to complete the conditions of appointment. My last question is in regards to the current staff in the office. Do you plan, if we were to select you as the agent, would you maintain the current staff, or will you just bring your husband and that additional person you spoke about into the store?
No, I don't want to work with him that much. Just kidding, sorry. No, my plan would be to maintain as many as the employees that are already there. They already have a base for what's going on. They understand their customer flow, and I think that's very valuable. I'm sure there's a lot that could be learned from them. And so if they are willing to be a part of my team and work with me and work together to make this a profitable, growing business, then I definitely would appreciate having them on.
Thank you. Thank you, Chair and Director Fleming.
Okay, any other questions?
Chair.
Commissioner Curran.
I just had a quick question. I appreciate your presentation. Thank you. I did appreciate the parts about community involvement. I was just looking on the statement for your deposit. Kelly is your husband?
Yes.
And I just had seen, and I could be wrong, that's why I was just wanting to see that there was an influx of a $25,000 and a $60,000 deposit recently, like last month. And I didn't know if that was a loan that you'd gotten from somebody or just.
Oh, I'm sorry. A little overlap. I didn't mean to cut you off. There is some of that, about 60,000 is a credit line. And some of that is he has downsized, he's a farmer, and he's been downsizing his operation. And so we have been selling off equipment. And so some of that would be the equipment influx. And since the original application, there's been several thousands of dollars added to that to make the funds available.
Perfect. Yes. Thank you.
Mm-hmm.
Any other questions?
Mr. Chair?
Yes. Brian.
So we now have the internet service providers up and running. Both applicants are here. And for the courtesy to Kevin, I'm going to have Kevin just wave, say hello real quick, because he didn't get the benefit of being on the screen for his presentation. So say hello, Kevin.
Where is Kevin?
Hello, everyone.
There you are. Okay.
Thank you. Okay, so with that, we'll go to our third and final applicant. Jennifer, I hope I get your name right. Jennifer Wickers is the third and final applicant.
Correct. You got my last name correct. So yeah, thank you for the opportunity to be here. My name is Jennifer Wickers. This is the future of the Ontario liquor store. Next slide. So I'm married to a first responder and have two small children, Dean and Joey. I grew up in Jim County. I purchased my first house there 12 years ago. I've worked in customer service for the last 16 years. I've been employed by the Ontario Liquor Store for the last 8 and been the store manager for the last 7. Next slide. I currently oversee all the day-to-day operations for the store. I make sure all the sales reports are accurate and sent in on time. I do the banking, which includes doing daily deposits and getting change for the weekend and in the upcoming week. I do all the ordering for the store. I do the liquor ordering from OLCC, all the beer and wine ordering, as well as any other needed supplies, paper, anything else like that we do need. I also am in charge of maintaining all of the inventory, which includes doing monthly cycle counts, making sure all inventory is created correct, or inventory is correct, checking in with all the deliveries, checking non-negatives, making sure all that stuff is up and running correctly. Every morning I'm at the store at least 15 minutes early just to make sure that the store is open and ready for a successful day of business. I manage all personnel staff, which includes doing all the interviewing, all the hiring, all the training, also all the monthly scheduling for all of us, myself included. I also run the store's social media, so we do have a Facebook page. I put all the new recipes, any new products that we have, any changes with hours, with holidays, or anything like that. So next slide, please. This is a picture of the future layout of the store. I've already rearranged things a little bit, but this is kind of my future plan that I have. Next slide. This is a graph of the last 5 years. In 2017, we were at 1.852. This year, we're projected to do 2.37. I know we can hit that, especially with some of the bars opening back up. Sales are progressing and every single day. Next slide, please. So in 2011, our store only did 1.12 million. This year, like I said, we're projected to do 2.37. I know we can hit that. I know we're working very hard to get to that. I'm a goals person, so every month I look at our sales projections and I always try to hit that or exceed. You can ask all of my staff at the end of the month. I'm like, hey, we need to do this much for this day to make it all work out. My goal for 2031 is 5 million. That is quite a bit of growth in the next 10 years, but I believe you have to have goals so you have something to strive for. Next slide, please. This is what I have planned for the future. My main plan is to upgrade our security system, better cameras, clearer pictures, everything like that to keep us safe. We currently have a few blind spots that I'd like to address and fix as well. I want to add additional lighting to our exterior and upgrade our lighting on the interior. I want the exterior to feel bright and safe for both the safety of my customers and my staff. I know the customers are more likely to come into a store if it does look bright and inviting. I plan on painting the exterior as well. Our paint is currently peeling off and there's some paint damage due to, we just had our parking lot repaved this last year. I plan on updating our bathroom. We need a new water heater currently, and our pipes need to be updated due to them leaking periodically. We currently have a hole in the wall behind the bathroom toilet that needs to be patched due to pipes freezing. While that's open, I plan on installing a hose bib on the exterior. That way we can have a hose outside so we can clean off the building, clean off the parking lot, clean off our filtration system for our HVAC system up on our roof. As you saw on my future layout slide, I want to reorganize the back room as well. I want to optimize the productivity, and because there's a lot of wasted space that we have, that once we do clean up some space, it'll give us room to grow. It'll help us expand a little bit. Next slide.
How much, this is Chair Rosen, what's your estimated cost on that last slide?
So I don't have all the estimated costs on that. Honestly, my husband's a plumber. He does plumbing and HVAC. So I have all the plumbing, all the bathroom stuff, all of that free, taken care of. We have looked at some lighting. It depends which lighting I do decide to pick. I've looked at, like Kevin mentioned, I want to upgrade to all LED. We have our registers above the front register, or our lighting above the front register is currently LED, but that is the only one. So we just need to do a converter on all the rest of the lights.
Okay, that was helpful. Thank you.
Yeah, no problem at all. So I am currently have a home equity line of credit in place with US Bank. That's how I'm planning on financing part of the store. I do go sign for it Monday, depending on how today's meeting goes. So I have that waiting on me. Next slide, please. So the main question is, why me? Honestly, this job already is a huge part of my life. It's not just a job for me. I've been working here for quite some time. It's grown from a small liquor store to what it is today, and I'm honored to be a huge part of that, honestly. I know with my knowledge and my drive that I can help excel even more. I've already developed relationships with all of our local distributors, our freight company, and my district manager, Graham. I know all the day-to-days in and outs of how to perform them and goals. And my goal mostly is to make this transition as seamless as possible. Like, I know there's not going to be a huge difference in the beginning between Kent leaving and myself taking over. I have the willingness to grasp all challenges and changes brought upon me and the ambition to take them head on. So thank you guys for the time. Have any questions?
Commissioners?
Chair Rosenbaum, Director Flemings, Commissioner Harper here.
Go ahead,
Okay.
Commissioner. Yeah.
Okay.
We can hear you.
Thank you, Jennifer. Thank you so much for your presentation. It's phenomenal. You took out again a number of questions for a guy that has to drive 5 hours and 39 minutes to get to your place. I really like the portion in regards to updating bathrooms, because at my age, the bathrooms are real important. So congratulations on that, and thank you so much for updating us on your team, the husband, the plumber. So my question again is in regards to lottery, and the second question is, did you experience long lines outside of your store during COVID?
So lottery, the current owner, the current agent, Kent, and myself, we've actually looked into lottery and the cost of what it would be and how much we would actually make. At the time when we looked at it, which was probably 2 years ago, it wasn't beneficial to us, and it was just honestly a risk to have all of that lottery system and all the extra unclaimed lottery in our store, and it would also take quite a bit of space up. I have thought about it, but it probably wouldn't be for quite some time, or if it would be a different setup from how we currently have it. And then what was your other question? I'm sorry.
In regards to the lines outside of your store during the COVID.
Yeah. So honestly, we normally had, I'd say the only times we really had lines were Christmas Eve, Thanksgiving Eve, like New Year's Eve, like our biggest sellers. So we did have a few lines. I personally brought in like a Easy Up pop-up tent if we needed it. Thankfully, the weather was nice enough that we never needed it. We had a few lines just because of I limited the amount of people that were in store at a time. So that was the biggest reason we had delays and customers entering the store and lines outside, like just because of the stipulations of how many people were allowed in the store at a time.
And our last question is in regards to, there's always a position to hire all the staff that's excited about PR. In your, what you currently have in technology, do you have a place on your website where they can, people looking at a product can just hit a button and go directly to the OLCC website?
No, we don't. But honestly, all of our customers that do come in, we have we have given them the knowledge to go on to Oregon Liquor Search to look up products like that. We have quite a few people who do come in who do use our Oregon Liquor Search and find products, see that our store has them, or always call us on a daily basis. We have customers calling us to see if we can order in different products for them. And every single week we have at least a few items that we do order in for different customers. Our Facebook page is just currently a normal Facebook page, so all the messages go straight to myself, and then I try to answer them as fast as possible and give the knowledge to all of our customers that are reaching out to us.
All right, and then the last question, sorry, I said last question last time, Chair, but my definite last question is in regards to, again, community involvement. I understand that painting a building and changing a sign is important, but the relationships we have in our community is of great value. It assists you in everything from security to just the promotion of our product. Where are you at in regards to that? And will you continue your efforts to share with people about, not only wearing masks, but understanding, driving and drinking rules?
Yeah, so local people around here, I do have a friend who's in charge of like the COVID-19, the research and stuff like that, that actually works for the city. But that's the biggest thing like that. We do honestly have quite a few customers who are first responders, who are law enforcement, who are heads of companies and heads of businesses around here that we talk to. We actually, with all of our training, that's one thing I've really pushed with all of my staff is that we definitely, like, if I have a VIP that comes into our store, we refuse service. So I've done really good at educating all of my staff. All of my staff is very bright on that subject. So I feel like in store, we handle that pretty well. Yes, I definitely, owning the store, I would get to know a few more individuals, a few more people, be able to educate, being able to learn more about the public and getting that knowledge from them as well.
Thank you.
Yeah.
Thank you, Commissioner.
Chair Rosenbaum,
Yeah, no, any other, yes.
Commissioner.
Commissioner, oh, thank you.
Yes. Jennifer, great presentation. Thank you so much for that information. You have seen great success in your store the last few years. What do you attribute this success to?
Honestly, so there was a couple years that there was no growth in our store at all. And on my end, that was kind of a hard thing to realize and to see. We did, honestly, a year ago in July, so now it's been a year and a half, we became a non-exclusive location. So we started getting in the beer, getting in the wine and stuff. Since we are located so close to Idaho, we have quite a few customers, Idaho residents that come into our store. One thing we've really pushed, me and my staff have really pushed in the last couple of years, is being able to get in those different bottles, that specialty stuff, the vendor allocated stuff. In the last 2 years, we've actually been able to get in more of those high-end stuff. And that has definitely brought in a lot of high-end customers, a lot of repetitive customers, people that call us to get specialty items for them. So stuff that they can't get in Idaho, they can get with us. And so we've definitely tried to grow more and more every year and just getting the knowledge to other people that we are here. I honestly have had individuals still not realizing that we're open on Sundays. So that's one thing I really want to push as well. And we've been open on Sundays for 6 years now, and it's still a surprise to some people. So I really want to push that, really want to educate people, because I believe Sundays will help. We're only open 5 hours, but even that Sunday business, keeping it consistent, regular, it'll help us as well.
Awesome, great. You've got a pretty ambitious goal, which I love to see, by the way. It is quite an ambitious goal to hit 5 million by 2031, right? What are your plans to achieve this goal?
Like I said, just kind of expanding what we have. I do want to modernize a little bit. Mostly it's a lot of education, getting it out there. I hope that we can still, talking to you guys even, and pushing with you guys. I know Graham's gets annoyed of hearing from myself and Kent about we need more product in, we need more higher end stuff. We have a lot of those residents from Idaho that can't get that specialty stuff that they come to us. So I know if we get that stuff in store, we will sell it, we will help. Every year we're just progressing more and more. And I know that modernization a little bit, just upkeep, stuff like that will definitely help like bring the awareness. Like I want to change the color. Our store is like a tan color. I don't know if any of you guys have seen it, but it's very generic, very basic. It actually blends in with all the buildings around us. So I like something a little bit, not necessarily bolder, but a little bit brighter to bring in all those people. So yeah, thank you.
Great. And last question, and I promise I'm like Commissioner Harper, I promise this will be my last question. Do you have a good relationship with your licensees, or how many licensees do you have? Does your business have?
So I'm actually
a great opportunity. Excuse me, not to cut you off, Jennifer, but I see that as a great opportunity to hit, try and hit as many licensees as you can to get as close to that ambitious goal that you have.
Yeah, so actually I'm pretty familiar with all of the licensees, either their managers and their owners, both of them. I'm actually currently at the store because I have to work this morning. Both Kevin and myself have to work once it's over with. I have all the licensees next to me. I have 1, 2, 3, 8. We have 25, I'd say, licensees. Majority of them are reopened. There are a few that we haven't heard back from, but we keep a really good relationship with them. We try to interact with all of them. I personally don't live in town, so I am not one to go out. One of my employees currently, she works at one of the bars. Kevin works at Burt Scrowler Garage, which is another one of our licensees. A couple of our bars are owned by the same two people, so we keep that relationship with them. I know all of them. All of them know me, so I feel like just educating them too, like getting the knowledge to them, like, hey, we have this new product. There's a couple of bar owners that actually come in and pick up their orders. So every time they come in, I'm like, hey, we got in this week, or we got in these products. Or, do you want to try this? And so I try to upsell that, and definitely bringing in the leaders for the state has helped our sales as well. And just getting the knowledge to all those licensees that, hey, we have these leaders, they are a better deal than the FIS are, and try to upsell them to those as well will help our sales grow as well.
Great. Thank you so much. Thank you, Jennifer.
No problem.
Any other questions? Brian, I have a question for you. Is there a fee or something along the lines of some sort of a obligation for whoever gets this store to pay the former owner of the store?
Chair Rosenbaum, the answer is yes, and that's part of the beginnings of your materials. And it's the fixtures and equipment buyout, or fixture and equipment for what has been appraised. And then also the resignation buyout, which, some call it a blue sky. And the total estimated for this is about $115,000. Currently, the resignation buyout is $78,000, and then the approximate estimate for those things to sell spirits, which is what the spirits are housed on, is about $27,000. So yes.
So what? Yes, I know that. And what's the total of that?
The estimate here is 115, and the estimate is because we have to include up to 2 months operating expenses, because it's possible they won't get paid for 30 to 45 days after they begin operating.
So my question is that I'm looking, you have $135,000 in a home equity loan, correct?
Mm-hmm. Correct.
So you're not going to count the Kevin and Sandra Holbrook money of $83,000, correct?
That is an option as well. I also included my savings. We also have about $35,000 in savings as well. My husband and I think my savings document to you guys before was about $25,000. I have already discussed with the current agent, Kent Anderson, about buying him out and what the rent is going to cost and everything. And we already have that kind of lined out in that agreement. Depending also how this meeting goes, we're going to meet with an attorney on the actual building expenses and anything else like that we need to figure out.
Well, I'm just referring to numbers now. You're taking away the Holbrook account. You have $135,000 on a personal equity loan.
Mm-hmm.
You've got 25,000 in personal savings. So you've got, around $160,000. You're going to take away 115,000 or thereabouts as your obligation. Tell me how concerned you are after you take a look at what the real numbers are. And then I asked you the question about your remodeling, and I like the fact that your husband can do a lot of it, but let's take another 15,000 realistically.
Yeah.
So you're down to an emergency basis, if God forbid that happens, of about $15,000 to $20,000.
Well, yeah, the renovations aren't necessarily going to be day one or before we even open. I mean, that is going to take some time. It's not going to take a lot to start up on everything. I have priced some stuff out, like I said before. But yeah, once the income's coming in, because we also have all that beer, all that wine sales, estimated how much we're going to sell for the day. The first weekend we do take over is actually Easter weekend, and that's always a big seller for us. So that's a Thursday, Friday, Saturday of sales. So just kind of keeping that income in. My plan is to not necessarily have a huge staff as we start. One of the biggest expenses for my current agent is myself, paying myself out. I do already have a manager set up for if I do get the position. And we're just going to go from there. But I'm not necessarily worried about financing. Like I said, I do have, and my husband is still, we still have our personal account. Thankfully, we're pretty well off on that end as well. But that's not something I'll pull from until I actually need to be pulled in from.
Well, I understand. I'm not picking on you. The other two applicants are in the same boat as far as I'm concerned in terms of their finances. I just wanted to bring it to the attention because you may not be concerned about it, but I think the commission at least has to look at it in terms of financial responsibility and what's going on with it. So, okay, I don't have any other questions.
Okay, well, thank you.
Thank you so much.
Chair Rosenbaum, if I may, for the applicants that are here, just place yourself on mute. Laura's going to instruct us where to go and just sit here until we come back. Go ahead.
So I'm going to go ahead and mute all, and then commissioners and staff that are in agent deliberations, if you'll go to the Teams link and go ahead and keep this link open, that'd be awesome.
I think the chair has to take us to the session. Sorry.
Okay. We need to go into executive session now for deliberations of agent selection on the PER ORS 192.660 sub 2 sub A. So I think everybody has the link. So we'll get off of here. I guess we're just going to get off of this and then come back on it, and we'll see you in a minute or two.
Yep.
On the other link.
Right. Don't close this out. Just get on the next link. Yes.
I'm not sure I know how to do that, but okay. It's okay.
You do what works for you.
Okay. Bye-bye.
Hello, everybody. We're coming back to the meeting. So if you'll just give us a minute and we'll get all the commissioners back in. Chairman, it looks like you're here, and I see 5 commissioners, including you. So looks like we're still waiting on Commissioner Pausick and oh no, I see Commissioner Harper. Commissioner Pausick, oh, there you are. What are we missing then? Could we maybe just do a quick roll? Chairman, can you hear me? I see you're unmuted.
Hey, Laura.
Yes.
I'm not seeing the chair on my board. I don't know if there's something, a hiccup here.
Okay, thank you. I see him, but
No.
oh, there he is. Yeah.
There he is.
Can you? Can't hear you, Chairman.
Can you hear me?
Yes.
Yes.
And it looks like
Okay.
we have all 7 commissioners on.
Okay, we're back. Commissioner Floyd, please.
I move to appoint Jennifer Wickers as the permanent agent at store 1011 Ontario, effective April 2021.
Thank you. Will you please take the roll call?
Commissioner Curran.
Yes.
Commissioner Floyd.
Yes.
Commissioner Harper. Commissioner Harper. Maybe we'll come back. Commissioner Miletus.
Yes.
Commissioner Pausick.
Yes.
Commissioner Raval.
Yes.
Chair Rosenbaum.
Yes. Let's leave the roll call open for Commissioner Harper if we can get him back on the phone.
Okay.
Leave it open for the next couple of minutes. Congratulations. Thank you all for participating. We were impressed with everybody, and I really mean that. So let's go on to the next, which is the alcohol violation stipulation settlement agreements. And Sarah, are you on the phone? I can't. No, your mic isn't working.
I did. Now
Okay.
I have turned on my camera and turned on my mic. And good afternoon, Chair Rosenbaum.
Good afternoon.
Chair, members of the committee, commission, I am here on behalf of the Administrative Hearings Division to propose to you that you consider for ratification and to recommend for ratification 2 alcohol violation stipulated settlement agreements. 1, 501, hold on a second. 501 Grill has
Yes.
been removed for further consideration based on additional facts, which has just come available.
Very good. Any commissioners have any questions on it? If not, let's take the roll on it. I need a motion on that, please. I'm always ready to take the roll without the motion.
Chair.
Commissioner Floyd, thank you.
Commissioner Floyd here. This is usually Harper's task here, but
I
hey,
know. That's why I was laughing.
I move to ratify the 2 alcohol stipulated settlement agreements as proposed by staff.
Thank you, Commissioner. No further discussion. Please take the roll.
Commissioner Curran.
Yes.
Commissioner Floyd.
Yes.
Commissioner Harper.
Yes, am I back?
You are back.
Yes.
All right, and I vote for our new agent in Ontario. Thank you.
Okay.
Thank you, Commissioner.
Thank you. Commissioner Miletus.
Yes.
Commissioner Palcic,
Yes.
Commissioner Revel,
Yes.
Chair Rosenbaum.
Yes. Okay, let's go on to the marijuana violations.
Chair, members of the commission, I propose on behalf of staff that the identified marijuana violation stipulated settlement agreements be ratified by the commission.
Any questions? I have one quick one, and I know we probably went through this before. On Stoney only, what's that? That's really a interesting name, Stoney only. They're selling the license, so there's no penalty here. There's no monetary consideration. If they were to come back in 3 years, what would be their status? I mean, would they then have to go? They have to go through the process, but would there be any monetary fine for them or anything if they applied and we actually gave a license again to somebody in this category?
Chair Rosenbaum, I believe I might be able to provide some information in regards to your question, but I think the best person to answer it would be Kelly Rout.
Kelly must be on somewhere. Where are you, Kelly?
Good afternoon, Chair Rosenbaum, members of the commission.
There you are.
Hi.
Our go-to person. Thank you.
Yeah, no problem. For the record, Kelly Rout, Director of the Administrative Hearings Division. Yeah, so when we resolve a case for license surrender, the case is done. And so we don't hold any monetary penalties or anything like that in abeyance. If this person were to apply in the future, we would be looking at their compliance history and whether they would be licensable, but we would not be assessing any monetary penalties again.
Okay, thank you. I just was curious about that. Let's take the roll.
Chair Rosenbaum.
Commissioner Revelle, please.
I move to ratify the 3 marijuana stipulated settlement agreements as proposed by staff.
Thank you, Commissioner.
Commissioner Curran,
Yes.
Commissioner Floyd,
Yes.
Commissioner Harper,
Yes.
Commissioner Miletus,
Yes.
Commissioner Palcic,
Yes.
Commissioner Revel,
Yes.
Chair Rosenbaum.
Yes. Okay, we're going on to rules and information on Delta 8 THC and other artificially derived I can't pronounce it. Steve and Anthony, you're up.
Chair Rosenbaum, members of the commission, my name is Stephen Crowley. I'm the hemp and processing specialist here at OLCC, and I'm here with my colleague Anthony Galtowski to present some information about Delta 8 THC and other artificially derived cannabinoids. For the purpose of this presentation is to provide some background and context for the rulemaking that staff will be asking you to initiate. And we have a PowerPoint prepared. Laura, is that ready to go?
Almost. There you go.
All right, next slide, please. So the first question is, what is Delta 8 THC? And the most important thing to know is that it's an intoxicating cannabinoid. Usually when people talk about THC, they're talking about Delta 9 THC, which is the primary intoxicating component in cannabis. Delta 8 THC has a very similar chemical structure to Delta 9 THC. As you can see in the image below, they just differ in the position of one double bond in that upper right-hand corner of the molecule. And users report that they have very similar intoxicating effects, with Delta 8 just being somewhat less potent. Delta 8 THC has been reported to be naturally occurring in cannabis at very small concentrations, but the vast majority of the Delta 8 THC currently being sold is created from CBD by chemical processing. Next slide, please. So Delta 8 THC is most commonly made from CBD. That CBD is extracted from cannabis, usually from hemp, and the extracted CBD is then mixed with an acidic catalyst and heated for a period of time. And that process converts much of the CBD to delta-8 THC. But this process also produces a significant amount of chemical byproducts, and it's not clear whether or to what extent the delta-8 THC manufacturers actually attempt to purify the delta-8 THC to remove these byproducts or the catalyst. It's common to see certificates of analysis for delta-8 THC distillate that have between 70% to 85% delta-8 THC, with the other 15 to 30% being unknowns. And it's common for typical cannabis extracts to have some unknowns, but those are usually substances that naturally occur in cannabis, such as plant fats, waxes, flavonoids, and terpenes. In delta-8 THC, it's usually made from high purity CBD isolate, usually upwards of 99% purity. So when the starting material is that pure, it means that any of the unknown components in the resulting mixture are chemical reaction byproducts rather than substances that were extracted from cannabis. Next slide. So the next question is, why does delta-8 THC matter? And the reason that it matters is many hemp-derived delta-8 THC products are completely legal commodities in Oregon. Outside of the OLCC market, these products are subject to very little regulation and can be sold by anyone, including to minors. This is not an intentional feature of Oregon law. Our state's laws around cannabis were written without considering the possibility of artificially derived cannabinoids being manufactured from cannabis. But this means that delta-8 THC is not tested for, and it's not subject to the THC limits that the Oregon Health Authority has established for adult use marijuana items. Because there isn't a long history of humans consuming delta-8 THC, the long-term effects of consuming delta-8 THC are unknown, as are the health effects of consuming the chemical byproducts and impurities in these items. Additionally, consumer understanding of these products is limited. Many manufacturers market these products as though the delta-8 THC occurs naturally in hemp rather than being artificially derived by chemical conversion from CBD. Next slide. And so this slide shows why we're talking about this issue now. Delta-8 THC has seen a huge surge in popularity beginning this past summer, and that seems to correspond with the oversupply of CBD in the hemp market following the passage of the 2018 Farm Bill, which made hemp legal nationwide. Converting some of the excess CBD into delta-8 THC provides an additional market for oversupplied hemp businesses. And here I'll hand things over to Anthony Geltowski to talk about some of the actual products that we're seeing and discuss the challenges presented by labeling these products.
Chair, Commissioners, good afternoon. For the record, my name is Anthony Geltowski, and I administer the OLCC's Packaging and Labeling Program. I will be discussing the labeling and testing of delta-8 products. First slide provides an overview of the labeling issues. In the OLCC marketplace, delta-8 THC products are primarily labeled as hemp items because the vast majority of the CBD used in the isomerization process comes from hemp. Note that the OLCC's packaging and labeling rules only apply to products being sold in the OLCC marketplace. Those that are sold in the general marketplace are not subject to the OLCC's labeling rules. So hemp products that you might see at Whole Foods or the corner market are not subject to our rules. OLCC's labeling rules do not contemplate labeling products with delta-8 THC or other artificially derived cannabinoids. This is because when the rules were written, experimentation with these substances was not yet widespread. Only delta-9 THC and CBD are required to be listed on a label. Delta-8 THC and other artificially derived cannabinoids are not required by rule to be listed on a label. This creates a public safety risk because consumers may become more intoxicated than they anticipated. Additionally, they may not fully comprehend what they are consuming. For example, the label may omit the product has delta-8 THC and the consumer becomes overly intoxicated. Or the label does list delta 8 THC, but the consumer does not understand delta THC is psychoactive. And lastly, the public likely assumes that cannabis products with delta 8 THC or other artificially derived cannabinoids are, quote, all natural. That is, the cannabinoids are extracted directly from the cannabis plant itself and are not the result of a chemical conversion process in a lab. And this prevents them from making an informed decision about what they're consuming. Next slide, please. This next slide provides an example of the unknowns that Stephen spoke about earlier. This certificate of analysis, or COA, is from a delta 8 THC hemp extract. The total delta 8 THC is 54%. The total delta 9 THC is 1%. The total CBD is less than 8%. The total cannabinoids detected are 57%. That means that the other 43% of this product is of an unknown composition. Now, Stephen spoke to this a little bit earlier, but I want to hit this. And typical cannabis extracts do have some unknowns that are not required to be tested for. But these are substances that naturally occur in the cannabis plant. However, a 43% unknown composition is well outside the norm. Next slide, please. This slide provides the COA showing a delta 8 THC product circumventing recreational concentration limits. This COA is from a 60-gram edible containing 10 servings. The total delta 8 THC in the package is 254 milligrams. The total delta 9 in the package is 8 milligrams. If this product were a hemp edible, it would be legal to sell in the general marketplace. Note that the recreational concentration limit set by the Oregon Health Authority for marijuana edibles is 50 milligrams of delta 9 THC in the package and 5 milligrams per serving. I will now turn it back over to Stephen. Thank you.
Thanks, Anthony. So in terms of OLCC's approach, we really only have the ability to address these products in the context of the regulated adult use marijuana market. Our rules don't have any effect on the broader problems in the general marketplace. But within our regulated market, we have carefully considered delta 8 THC in the context of our existing rules and determined that the manufacture of these products is currently prohibited. Our rules prohibit treating cannabinoid products, concentrates, and extracts with any additive that increases potency. So treating CBD with a catalyst to convert it to THC increases the potency and is prohibited. Next slide. And this also applies to hemp-derived delta 8 THC products in the adult use marijuana system. We have rules that say all requirements for marijuana items apply to hemp items, so increasing the potency of a hemp item by converting the CBD to THC is also prohibited. And hemp registrants who have the ability to transfer products to OLCC licensees can only transfer hemp items that comply with all requirements for marijuana items under OLCC's rules. So they do not have the privilege to transfer delta 8 THC or delta 8 THC products to OLCC licensees. Next slide. There are currently some products containing delta 8 THC already on the shelves at OLCC licensed retailers. These products had labels approved before OLCC had considered the full scope of this issue and determined that delta 8 products are effectively prohibited under our rules. At this time, our staff are not taking compliance action on these products that have previously approved labels, but the question of what to do with these products that are already on the shelves is one of the subjects that staff would like to explore during the rulemaking process. Next slide. So we've spent a lot of time discussing delta 8 THC specifically because it is seeing a lot of intense interest right now. But if we zoom out a little bit, delta 8 THC really is just the tip of the iceberg on this issue. The broader issue is, how do states regulate artificially derived chemicals that are made using cannabis as a starting material? Right now, the legal cannabis industry is still young, and there are a lot of creative business people exploring the space. And as regulators, we need to take a thoughtful approach and make sure that our rules are prepared for whatever the next trend is without putting consumer health and safety unnecessarily at risk. After all, CBD and THC can be converted into a whole range of other cannabinoids. Some of these occur naturally in cannabis to one degree or another. Others are novel cannabinoids that have never been found in the plant. And as states begin to grapple with delta-8 THC regulation, the industry could simply pivot to a different artificial cannabis derivative. Next slide. So staff is asking that you initiate rulemaking to address delta-8 THC and other artificially derived cannabinoids. We don't yet have any proposed rule language, but we are looking forward to exploring a variety of possible approaches with stakeholders. Our rulemaking is not able to address the broader issue of untaxed intoxicating hemp cannabinoid products in the general marketplace that can currently legally be sold to minors. But we have begun meeting with our partners at the Oregon Department of Agriculture and Oregon Health Authority to discuss these issues. And Oregon legislators are also beginning to take a look at these issues. Legislation may help to guide our approach in rulemaking and clarify OLCC's authority to regulate these substances within Oregon's adult use marketplace. We anticipate this issue being discussed at a legislative public hearing on House Bill 3000 next Thursday. And thank you for bearing with us. I know this is a dense topic, but it's something that is really important for our licensees and to Oregon consumers. Thank you.
Sorry.
Yeah, can you hear me now? Yes?
Yes.
Somebody say yes?
Yes.
Okay. Commissioners, any questions?
Go ahead, you.
Oh, I just more of a statement a little bit, but there is a question feathered in here. I think that, especially in this burgeoning industry that we have, I think that consumer confidence is the name of the game. And I can see why we'd want to do this beyond the fact that just the health risks that might be unknown to a consumer along the way, or could fall into the wrong hands as well, more easily in this case. My concern, and maybe this will be sussed out in the rulemaking, would you be trying to craft something that, it sounded at the end like it was almost whack-a-mole, like it could be whack-a-mole, through, okay, we have it nailed down and it shifts and it can be manufactured differently. And my hopes are that we would look at having, and I guess this is the question, are you going to be able to cast a broad enough net to cover all these, or are you going to be trying to play whack-a-mole, I guess? And I guess that might come out through the rulemaking process itself, but I just worry about that we might write something so explicit that it might not be able to cover what's next. Care to comment?
Any comment on that?
Mr. Chairman, this is Director Marks. I think it will be whack-a-mole a bit because we don't have sufficient authority over total THC in Oregon. We do have authority over our parts. So until we get legislation that really gives the state a mandate on total THC and intoxicants coming from cannabis as being within the regulatory structure for all cannabis, then I think we'll have a basis to set dosage standards, milligrams for things that are allowable for human consumption, maybe in a recreational market or otherwise. But until we get that and an ability to do final product testing to help get these things into the right markets where they're supposed to be, either in the unregulated hemp CBD market or loosely regulated market or into our market, it's going to be hard. We really do need clarifying legislation. All states are facing this issue right now, and that only gives you a basis to go forward and look at how we set, human consumption standards for total THC. How much do you count Delta 9 and Delta 8 and a concentrated vape and what they do together? So it's going to be a process. This will be if we had such a authorizing standard, it would be a lot of the same work recreated for us that we've done since vapes and marijuana and setting standards for human consumption really came into being. And a lot of work here, but for public health reasons, the intoxicants are not getting regulated without such a standard.
Any other questions or comments?
Chair, yeah, I think Commissioner Palstik's question is right on. I think it in a sense it is whack-a-mole, but in a sense it's kind of that's what we do. It's like this whole thing's been evolution. And I think that I commend the staff for taking this on, because in a lot of ways it is a national problem, but I think with the way our market's set up, the robustness of it, the amount of licensees, the amount of innovation that takes place here, and the experience that the agency has in doing it, I think we're really at the tip of the spear in terms of being able to address this stuff in a way that I think very few state regulatory agencies are. So it's an opportunity. I think what I was also encouraged to hear is that we're not taking enforcement action against folks, which I think is important, because everybody wants to be innovative, everyone wants to go to edge. We just got to make sure that edge is safe and it protects the market that everybody works so hard to build, because it's like with the Delta 8 stuff, they can sell it anywhere. And folks have gone through a lot to get their retail store set up to play within the system, and with it evolving so quickly, it's tough to, as Commissioner Palstik said, cast a broad enough net to catch everything. So I'm encouraged by it, and it's been a cool evolution to see people that were very opposed to regulation now starting to embrace it, especially in the industry, because I think they realize that it actually is beneficial. So thank you to staff, and it'll be a good conversation to have.
When this was first brought to my attention a month ago, alarm bells really went off in my head. And they went off in my head for one reason, is that we're sitting here and you have, in this situation, after what we just saw today, you have minors going into grocery stores, and they understand very well what this is all about. And let me tell you, if there's a way to find it, people will do it. And my only question to you, Steve, is have we even thought about making this an emergency situation? It is whack-a-mole to a certain extent, but why don't we just push this up a little bit if we can? If we can, I understand, but.
Well, I do, Mr. Chairman, and for the record, which I didn't do last time, Steve Marks, Executive Director, OLCC. I think what we're doing is pushing up. We're doing what we can today, and that's body blocking, high potency, produced out of our regulated system, THC, from coming in as an adulterant, basically. We're body blocking that, and we're starting the process of looking at establishing a dosage standard for Delta 8 combined THC within our system. But on the outside, the unregulated hemp has no final product testing. They only test for Delta 9 in the field. You can't regulate what you don't test for. And that's why the federalization has created a 50-state legal THC intoxicant market. And the fact is that works counter to everything the states have been doing to safely provide standards for the consumption of THC in a recreational market. So I think to answer your question, Mr. Chairman, I think it really takes legislative action on total THC measurement for us to take any effective action. You could say such products are illegal. They're probably illegal today under some interpretations of federal law, but you can't regulate it because you don't know it's in the products that are being sold because it's not being tested for. And the fact is the hemp products need a final product testing and a lab result to go with them to the marketplace, or the intoxicating points will be uncontrolled.
Here's a stupid question. Have you talked to any of the people in the legislature about introducing a bill on this basis?
and Steve Crowley mentioned it. It's House Bill 3000. So that'll be the state's first, attempt to make some convergence here with the least testing and some safety regulations over what's being produced by cannabis that's hemp today, and not in a more loosely regulated market than ours that certainly isn't regulated to adults over age 21, untested. And we're seeing the need for some convergence of this bifurcated federal system designated by federal law, marijuana being one part of a cannabis plant, Schedule 1 that's illegal, hemp on the other side being legal, thinking that it didn't have intoxicating characteristics, maybe a little bit of de minimis THC, CBDs for health effects, and you could use it for topically, but these edibles, these vapes that are being produced, are the same as what's in our market, essentially. So somehow the convergence between regulating the totality of cannabis plant production and what those products are that are going into human consumption is a logical outcome here. But because of the tracks of federal law, and we'll see what happens, in the next 24 months, we're likely to see some movement and changes in federal cannabis law, federal marijuana law. So hopefully this will not go unnoticed or unaddressed in federal law. And right now we have a chance to get it addressed in our state law. I'd note that states that have not promulgated or just getting their programs up, New York has a total THC standard. Every state in the country basically is trying to figure out what to do with these products now and how to regulate them. Some are banning them outright. Some are looking for uses in the recreational market, but no one has a testing regime in place, lab capacities going on and saying that we're going to get control over the totality of it yet. So this is the cutting edge of convergence here.
Right.
Mr. Chair. May I?
Commissioner?
Yes. It's interesting too that hemp, contrast to marijuana, which might have had kind of a very negative connotation. Hemp is kind of like the kale, of, it's like supposedly it's this it's wonderful thing and it has all these uses, and here it is being manipulated in a way that you can steamroll, and so getting our arms around it, I think, is important. I really do.
I think we all agree with it is. It is. Okay, Rosie, keep us apprised, please.
Yeah, Mr. Chairman, if I may, I just got to say, our staff work on this is exemplary. I think we are supplying a lot of the information that's going around the country and around the state and looking at this product. So I want to thank the team for making sure that we're in a position to informatively work at how we can address what is a significant public health problem and a risk problem. Not only a public health problem, it's a risk problem, an economic risk problem to our system of marijuana regulation, right? Thank you, staff, for producing this good work, and hopefully it'll be beneficial to the legislature as well.
Do we need action on this, Laura?
Chair Rosenbaum?
Yeah.
Thank you, Commissioner Revelle.
I move to initiate rulemaking and hold a rulemaking hearing at staff discretion.
Pardon me, Chair and Commissioners. Do you mind if I read the action into the record?
No, not at all.
Thanks. So good afternoon, Chair Rosenbaum and Commissioners. For the record, my name is Madeline Kane, Policy Coordinator for the Oregon Liquor Control Commission. Today, I have one initial action for your consideration. The rule package for your consideration is an action to initiate permanent rulemaking on the Delta-8 and other artificially derived cannabinoids package. OLCC staff have observed an increase of Delta-8, THC, and other cannabinoid products in OLCC licensed businesses, as well as the general marketplace. Delta-8 THC is a cannabinoid which can be manufactured by a chemical conversion process from CBD in hemp and marijuana. Delta-8 THC and other artificially derived cannabinoids are not currently tested for under OHA administrative rules, and the health effects of consuming Delta-8 THC and other artificially derived cannabinoids are unknown. OLCC staff will draft rule language that will address the processing, labeling, and sale of artificially derived cannabinoids in the recreational marijuana system. With that said, the staff is standing by to answer any additional questions you may have about this action.
Commissioner Rosenbaum. Chair Rosenbaum, this is Commissioner Revolve.
Commissioner,
I move to initiate rulemaking and hold a rulemaking hearing at staff's discretion.
Laura, please take the roll.
Commissioner Curran,
Yes.
Commissioner Floyd,
Yes.
Commissioner Harper,
Yes.
Commissioner Miletus,
Yes.
Commissioner Posick,
Yes.
Commissioner Revolve,
Yes.
Chair Rosenbaum.
Yes. Thank you, commissioners. Last but not least, Steve, do you have any comments or words of wisdom you want to give to us?
No, I think you had a lot on your plate today. Thanks for going through all of this. Appreciated the discussion earlier on public health and our partnership with and our relationship to the hospitality industry and bars and restaurants, and the importance of the governor's regulations and what happens from now forward. A really important discussion. The one thing that I will say is in that regard is Washington State, passed fee relief to their alcohol licensees, and then I think there is now, having seen that, been some legislative interest. I know I've been in a few discussions in the legislature now where there is some active consideration of what could they do for, relieving the fees from 2020 for our licensees, or sunset, or some part of that. As you know, we've deferred fees for folks, and some of them are carrying that deferment through, but we have no power to get rid of the fee because it's in statute. So a little bit of good discussion there. And so that goes hand in hand with our concern about getting folks reopened, but also providing economic relief is an important consideration as well in that discussion. I don't think I have anything beyond that unless anyone has any questions of me.
Commissioners?
Chair Rosenbaum, Commissioner Harper.
Yes, Commissioner.
I'd like to thank the commissioners again for the follow-up in regards to the questions in regard to the state and the not only COVID relief, but the vaccines and businesses having opportunity to open. I, as well as Commissioner Curran, saw bars and that were pretty excited about St. Patty's Day. And I just want to mention that I hope we're just as diligent when it comes to spring break, where more and more people are going to be out celebrating and visiting coastal towns in the eastern and southern part of Oregon. So I just want to say thank you for the knowledge that and the questions they presented this morning, and thanks for the doctor to come forward and encourage us and tell us about what's going on in regards to this incredible pandemic. Thank you, Chair.
Thank you, Commissioner. Well, I think that about sums it up. We've had a good meeting. For the commissioners, I'm tempted to introduce to you my co-chairman who's laying here next to the fire for the last 4 hours and never barked once. So, but I'm not going to do it. Have a great day. Enjoy it. Thank you all.
Bye. Thank you.